Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily.
Vanogita moru purita nonda kantai mantunat nyagi toru ilugar para honra para gloria abibai islasen para honra para gloria abibai islasen para kitodui tempui paz para ita dan gini langit na bendition contrai peligro na fansafuham Deus protegis languam contrai peligro na fansafuham Deus protegis languam.
soku Inini mastakalo Corazón Ten imas figu Nani nasinyahu Fresin my sadu Parabaputehi Ten defendi Hinengi Cultura Lenguaje Tanitano Tamoru, yes, yes, yes. Tanitano Tamoru, yes, yes, yes. Eden Shaku, la 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 la. Did I to get into stop that? 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 SD who what been my Ihilo. Zani Biblia, Ibandera, Ibandera, Mohan, yes, 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 Ibandera, Mohan, yeah. Mastakilu, hina soku, kinini mastakalo, ikurason hu, ten imas figu, nani nasinyahu, ufresin my sadu, parabai putehi, ten defendi, hinengi, cultura, lenguaje. Tamoru, yes, yes, yes. Tanitano Tamoru, yes, yes, yes. Ni ire shaku, la la la. Did I to get into stop that? 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 Yes, the who, what bit my ihilo. Tani Biblia, Ibandera, Ibandera, Mohan, yes, 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 Ibandera, Mohan, yes, yes, yes.
Good morning, Guam! Welcome, 625. Love that one. That'll get you going in the morning. A little bit of it at Fressy. Zach Lujan and the Higher Vibes band. It's containing COVID, the K-Wave News Takeover of Guam's favorite. Good morning, Sabrina.
Hi, good morning.
How was your weekend?
It was good, you know. I do what I usually do, and that's sleep a whole lot.
Right. I woke up early on Saturday morning. I woke up at 3:30 on Saturday morning, and I almost had a panic attack because I woke up and I was like, okay, what am I going to say about the legal counsel resigning? Okay, what am I going to say about Tom Adder? What am I going to say? And I just was sitting there trying to think, okay, maybe I could say this and that. And I was like, oh, my God, let me check the news, okay. And about after 20 minutes of that, I was like, oh, my God, it's Saturday. So, of course, I had called you.
Yes, and I woke up.
Yep. So that was my weekend. Sunday, it's always that way. Saturday, I got the muscle memory from the week, and I always wake up early Saturday, Sunday. I was able to sleep in, and I got to spend some quality time with the kids at the beach yesterday. We got a little beach behind the house, and was playing Balati games. You ever play those when you guys were growing up? You know the Balati, Bree?
I know what the Balati is, but I didn't get a chance to. Growing up, I didn't really grow up a whole lot on Guam, so
Yeah.
I didn't get to
That's
participate in those kind of games.
Probably why you're like that. You didn't get to play the Balati games enough.
Oh, so now
Balati
we're doing the
games-
Guam shaming game here.
Balati
All right, I
games
get it.
were the best. They were the best and the worst.
Right. The first time I ever shaved my head was because of Balati. You know when you whack it and the white stuff comes out? This is going... I don't know if this is the kind of conversation we want to have at breakfast, but the Balati, if you squeeze it really hard, this white, gummy, sticky substance comes out.
Viscous.
Yeah.
It's not. You don't even have to squeeze it real
You
hard.
don't have to squeeze it. Sometimes the slightest touch will just set it off.
Have you ever ate it though?
Yeah, I have.
I've never
Really?
eaten Balati.
It's salty.
Okay, for those of you who don't speak Chamorro or even slightly familiar, it's the sea cucumbers, and in
Right,
my
yeah.
opinion, I mean, you're a man of the South, right? Ipao Beach Balati. I mean, I love Ipao Beach. I spent my many days of my youth there. Ipao Beach Balatis were the best or the worst, depending how you look at it, right? Because like when they would project essentially what are their intestines, there's some thick Ipao Beach sand that's mixed in with that. So
Right.
that was like next level gunk.
So me and my cousins, we used to go down to Molesto Pier and we would, wrestle and stuff, and there would always be a Balati ready, and then when you would get headlocked, they would like rub the Balati in your hair.
Wow.
And the time they did it on me, it was just like the Balati blew its wad all over me, and it was all stuck in there. Man, my grandma was pissed off because I was my grandma's querido, and then she like a lot of asses got whooped that day.
You were
Because-
the Corrido?
Yeah,
Well, okay, you said you were wrestling, right?
yeah.
And of course-
WWF style.
No, I was gonna say, of course, children of the '80s, right?
Right.
Did your cousins ever do figure 4 leg lock on you?
Yeah, everything, man.
Dude, that seriously
Yeah,
hurts.
it does.
Camel clutch,
So
cobra clutch.
I was able to play that with my kids yesterday. I was just running around chasing the Balati, and then I started thinking, God, if I post this video, what if some like animal rights person is like, "What about the Balati? What are you doing?"
Oh, because you know who hasn't had a lot of press of any kind lately since the pandemic is PETA.
Yeah.
PETA's just like, they're just looking for an excuse to go after you.
So I guess I'm Balati public enemy number one. Well, Bree, maybe we'll get some time to play play with the Balati. You get your boy, I'll get my kids.
No, I'm definitely going to the beach.
Can we do a Zoom call with the Balati, perhaps?
Yeah, okay. All right. Are you all Balati'd out, Jay? Is there anything else you want to say about the Balati?
My morning has started, bro.
Okay, there you go. So, all right, let's give a little time to let that Balati conversation breathe. Yeah.
Real quick, Angelina posts a comment right now. She goes, "LOL, that's Guam's bubblegum." Wow.
You got to be real Chamorro if you're chewing that for bubblegum. Okay, 6:29. We've got a great, huge show for you guys. There's just a lot of stuff that happened over the weekend. There's a lot of stuff that happened over last week. So we are going to try and go in and unpack a lot of these resignations, the mass exodus that is happening from the Leon Guerrero Tenorio administration. We'll talk about that. We'll also get Uncle Carl on the radio. You guys ready for Uncle Carl this morning? He's going to call in. I know Uncle Carl's down, and he's probably feeling down. He was just so pumped for that tourism reopening, right?
Yeah, he had a beautiful commercial that was produced. Looked really good, sharp.
And then,
Nice.
voila, Taja. Comanso. Postpone. No more tourism for a while. They didn't even give a date, right?
No date.
You guys just like, yeah, okay, stand down. Give us a moment and give us another moment. Give us a longer moment. So we'll talk with, he's the interim general manager of the Guam Visitors Bureau, and find out what does this mean for his tenure there at the Bureau. I mean, he was in there for, I think, what was it, 3 months or something? Mm-hmm. So how are we going to, how is he going to retool this opening? Are we going to have a cleanup? What are we going to do? And,
I did see people cleaning up though over the weekend.
Right,
It was, they were posting pictures all over the Island-wide Beautification Task Force Instagram. So definitely, a lot of the government agencies still went out there and were sprucing up a lot of the parks.
yeah, I guess they were already in motion for it. You know what I
Yeah.
mean? To prep
Yeah.
for it, so they went out. It's 6:31. Let's do it. Let's start the show. We've got that and a whole lot. Let me see what else we got here. Yeah, we're going to go behind bars, check Major Anton Uggan from the Department of Corrections, because there was a positive case at DOC.
Another positive, yep.
And a positive case with the Guam Police Department. So we'll be talking with Major Anton. We're going to get tests from Department of Public Health. Wow, now that Linda was kind of our in. We're going to have to, well, I know Lori, so I think we'll be okay. Also, we're going to be talking with Pertay Lategzin as they are planning a big protest for Friday. Dr. Felix Cabrera of the Governor's Physicians Advisory Council also going to come on, and they've changed the quarantine procedures again. And we'll talk about that. There's just really a lot to talk about. We're going to try and squeeze as much of it as we can into the next 3 hours and 29 minutes of multimedia broadcast extravaganza. It's all proudly brought to you by IT&E, Ambrose Inc., Cowboy Enterprises, Coast 360, and the Bank of Guam. It is containing COVID. And let's do it. A dive into the day's COVID-19 headlines with the very latest from the KUAM News team. Good morning, Sabrina Salas-Mantanani.
Hafaday and good morning, everyone. The number of confirmed COVID-19 cases stands at 248 with 5 deaths, 179 recoveries, and 64 active cases. On Saturday and Sunday, Public Health's lab ran 486 tests, and again, 0 turned up positive. It's not clear whether a case reported by GPD was included in the total count over the weekend. GPD issued a press release Sunday stating that a police officer assigned to the Dededo Precinct Command had tested positive for COVID. The officer was identified through contact tracing, which means that he is connected to a confirmed case. The police officer is currently on home isolation. The Guam Police Department is working with Public Health to determine who may have had close contact with this officer. The Dededo Precinct Command remains open to the community. According to police spokesperson Paul Tapau, the precinct will still respond to calls and entertain complaints. As reported, 2 Department of Corrections officers have tested positive for COVID-19. One of the officers KUAM has learned is a female assigned to the women's unit in Mangilaw. DOC Major Anton Uggan says 20 female inmates are housed in this particular unit. At this time, other personnel and inmates have not been tested as a result of this second DOC confirmed case. The governor, meanwhile, on Saturday held a press conference making several announcements.
Good day, everybody. Sabrina Salas-Mantanani with the latest. Governor Lulian Guerrero held a press conference Saturday afternoon saying it was alarming that we have seen a spike in cases in recent days, but the increase was expected because we have increased our testing capacity. For now, all plans to loosen restrictions and further open up Guam have been shelved. Additionally, Public Health has seen an increase in cases in northern Guam and plans to hold more outreach in the area over the next several weeks.
Concerning thing for me here, and I think Public Health is too, is the 16 isn't clusters. It didn't come from clusters. It's now telling us that these are all over the community. And so that's why it's very crucial that we continue with our testing and we continue with our contact tracing. And that is why I put a delay and a hold on what other restrictions we were planning to lift. And so we're not going to reverse any of the restrictions we have made. We are continuing with the activities because we want to make sure the activities going on so we'll know what exactly is happening out there in the community. So that's why Dr. Cabrera is really tracking mobility, because as people are more mobile and we see that we're getting more positives, then we're thinking, hey, they're mobile, but maybe they're not wearing their masks. And maybe they're not social distancing. You know, these are the kinds of things that the complexity of it and the investigative questioning is what we need to be addressing, so we can really make sure we isolate and we prevent and protect. So this is the strategy. It's coming to fruition, like we said, and we are prepared and we have planned for this.
The governor also announced that no goal or date has been set to reopen the tourism industry. July 1st was the initial target date to reopen for tours from Taiwan, South Korea, and Japan. But again, the reopening has been postponed until further notice. One of the major announcements made during Saturday's press conference was another change in quarantine protocols scheduled to go into effect Wednesday, July 1st after midnight. All persons arriving to Guam will be still subject to a 14-day quarantine. For individuals who are traveling from a high-risk area previously referred to as a hotspot, a 72-hour pre-arrival PCR test is necessary to determine whether you will be quarantined at a government facility or home. And if you are on home quarantine, you would be eligible to test out after 7 days.
If you do have that test and it ends up becoming negative, then you have the early quarantine release, but you still must fully comply with the 14-day symptom monitoring and tracking. So that is key. So just because you get out on day 7 doesn't mean you're done completely. You still have to comply with this program.
As for an update on a hardened shelter for the island's homeless population, the governor said nothing was awarded yet. She said the biggest challenge has been finding a hardened structure to meet the guidelines and requirements for a homeless shelter. Meanwhile, today was the first press conference for Acting Director of Public Health, Lori Duenas, who takes over the agency after the announcement of the retirement of Linda and Pinko Denorsi after more than 3 decades at the agency. Media questioned the recent resignation and movement of several of her key cabinet members and whether there was word of a federal investigation. The governor said there was absolutely no truth to that. When asked about the loss of institutional knowledge of key cabinet members such as Denorsi, this was her response.
I'm not concerned that I'm losing institutional knowledge. Lori, for example, has more institutional knowledge than Linda. Lori started at public health way before Linda. In fact, Linda worked under Lori. So in the area of public health, I am very confident that the people that are there have the knowledge, the institutional knowledge, the scientific knowledge, the social knowledge, the investigative knowledge, the contact tracing knowledge. These people have worked with other diseases like tuberculosis, dengue fever. And so far, we've been kept pretty healthy. And the same way with our coronavirus. I attribute our containment to coronavirus because of the expertise of our public health. And so as far as institutional knowledge, there are people within those agencies that have more institutional knowledge than the people that have decided to retire.
Today, meanwhile, will be the first day on the job for the governor's new legal counsel, Leslie Travis. As reported, she is replacing Hai Hyun, who resigned Friday. Additionally, Airport Deputy Executive Manager John Kanata was approved by the board as the new executive manager. Kanata is a former senator, a former Guam Customs Director, and an officer with the Guam National Guard. He replaces Tom Atta, another former senator who abruptly resigned last week. The board also approved the hiring of Dr. Ricky Hernandez as the new deputy director. Hernandez is the current deputy administrator of the Guam Economic Development Authority. He also previously served as the director of the Office of Finance and Budget. Expanded community testing continues this week. Drive-through testing is scheduled at the Mangilao Senior Center and Night Market area near the Santa Teresita Church. Tomorrow is also the deadline to submit required documents for those of you who applied for the Programan Salapi Idzudan Itautau program. The Department of Labor, meanwhile, explains some common misunderstandings of PUA fraud. For example, to qualify for unemployment benefits, individuals must be able and available to work. The Guam Department of Labor reminds the public that pandemic unemployment assistance and federal pandemic unemployment compensation is not available to employees who refuse to go back to work or who quit in order to receive benefits. Director Dave De La Sola saying under the Coronavirus Aid Relief and Economic Security Act, quitting work without good cause to get unemployment benefits is considered fraud. If an employer calls you back to work and you reject the offer in order to collect benefits, that's also fraud. To qualify for PUA, you must be out of work or unable to go back to work due to one of the COVID-19 related reasons listed under the act. Quote, the department recently received reports of employees that collected their initial PUA payments who were not returning to work. Employees must understand if your employer fires you for not returning to work and you do not have an approved COVID-19 related reason, you are disqualified from receiving further PUA benefits from the date you were fired. Employers can report firing an employee to pua.fraud@dol.guam.gov. An immediate hold will then be placed on the employee's PUA claim. With regional news, we now check in with our Tomas Manglotnya, who is in Saipan. I think.
Good morning, Brie and Chris. Here's the latest making news in the CNMI. Even amid the pandemic, disability community advocates continue their mission in the CNMI to protect those in the community amid the pandemic. Here's more from NM Posse. Take a listen.
A virtual proclamation signing a sign of the times. Love wins in the Marianas as June is proclaimed Pride Month. Pride Marianas Youth founder and president Dr. Jennifer Maratita says it's the first official Pride Month in the Northern Marianas.
Just coming together and celebrating allyship as ways that we can support our LGBTQ youth. And this month is just a celebration, again, to acknowledge those who had fought, like we talked about, is really paving the way on the resilience of our community, that we're here and that we're not going away.
Jonathan Cabrera marked the event with a moving address.
Let us revel in our fabulousness and find ways to celebrate safely and responsibly during this pandemic. As happy as we should be during this month, wherein, at least for a moment, our LGBTQIA+ lives are affirmed in special ways in our community and in celebrations around the world, let us also remember, Pride started as a riot, which turned into a protest.
Paying tribute to the legacy of LGBTQ+ movement leaders, Cabrera also noting the value of every human life.
We are alive, hundreds of years, some might say thousands of years, and we're still here. Discrimination, oppression, shame, death, and we're still here. At least some of us.
That declaration drawing the support of dozens of online viewers celebrating from home, echoed by organizers from Pride Marianas and Pride Marianas Youth. Isaac Tenorio read part of the proclamation.
LGBTQ+ continue to push our community to aspire to greater existence by being more inclusive, creating spaces of belonging, and exemplifying compassion for every human in every walk of life. Passion for every human in every walk of life.
And again, that was from Pride Marianas Youth and Pride Marianas, where the proclamation signing was held last week. And just on Saturday, they held a Ride for Pride event celebrating Pride across the Marianas. And late yesterday, the governor's COVID-19 task force announcing scuba diving shops and businesses are allowed to operate while the grotto remains closed, according to a press release last night with approved guidance from the Commonwealth Healthcare Corporation and the governor's COVID-19 task force. They announced this weekend that those shops and businesses are able to open at the designated Marianas dive sites on Saipan, Tinian, and Rhoda, again, except for the grotto. They add that the grotto remains closed until further notice, pursuant to the directive that the governor signed and the CMI COVID-19 task force guidelines. They also explained that the task force advises any divers and instructors to practice social distancing during travel on the boat ride to the designated dive sites, as well as continuing good hygiene before and after diving activities. And the latest from the Commonwealth Healthcare Corporation's dashboard, as of June 26, the CNMI remains at 30 confirmed cumulative cases of COVID-19 with 2 deaths. And Saipan, Tinian, and Rhoda collectively have tested just over 8,000 people. The community is still waiting to hear on when village-based testing will be made available. Bringing Chris out to latest making news here in the CNMI.
Thanks, Tomas. Governor Lulian Guerrero signed several bills into law, including the highly debated Bill 366, restoring GovGuam employees' choice for healthcare provider. The governor in her message wrote that she signed it into law, quote, because I believe healthcare is a human right, and essential to that right is the ability to choose one's own physician. The governor, in the meantime, let Senator Amanda Shelton's Bill 367, the Adzuda Imangafa bill, lapse into law despite what she said included technical errors. As reported, the legislation suggests using the CARES Act funding for the program. The legislature cannot appropriate federal money. The governor in her message wrote, quote, it is because I value the overarching goal that I am willing to ignore the legislature's unintentional overreach into the congressional purse. The Supreme Court of Guam denies Mark Torrey Jr.'s petition for a writ to command the Superior Court to vacate its decision denying the dismissal of his case with prejudice. An amended indictment charged Torrey with aggravated assault and negligent homicide for the 2015 fatal shooting of fellow police officer Albert Piolo. Defense counsel Jay Areola argued his client's rights to a speedy trial were violated throughout the course of the government's second try of his case. According to the decision and order documents, the Supreme Court finds the lower court acted in good faith and the trial clock commenced on January 10th. Further finding, the defense's motion to dismiss told the speedy trial clock and resulted in the 95 days lapsed between his arraignment and the beginning of trial. Cultural and environmental advocacy group Protehi Litekten Save Ritidian will host a virtual press conference today in response to the recent clearing of 3 cultural sites eligible for the National Register of Historic Places for the construction of a proposed marine base. Representatives from numerous community organizations will make short statements during the press conference responding to the destruction. A peaceful protest will then be held at 3 p.m. on July 3rd at NCS outside the U.S. Naval Computer and Telecommunications Station to protest the clearing of the cultural sites. In national news, the U.S. reported nearly 45,000 new coronavirus cases in a single day, the largest increase ever. Florida saw nearly 9,000 new cases, and 5 million residents in the Houston, Texas area are being asked to stay home as the state struggles with a resurgence of the virus. Dana Bacchus reports from Los Angeles.
A level 1 red alert was issued Friday for the Houston area.
Today, right now, I am asking the community to stay home. Folks, let's be real. We will not get through this if we don't look at the reality of the situation.
Texas Governor Greg Abbott paused the state's reopening, shutting down bars again and scaling back restaurant capacity to 50%. This Houston establishment is urging diners to take precautions.
So if they don't come in with a mask, hey, here's a mask, this is the expectations.
Former CDC Director Dr. Tom Frieden says he thinks some states reopened too soon.
These are places that opened while they were still increasing. To open while you're increasing is kind of like leaning into a left hook. You're going to get hit.
Florida Governor Ron DeSantis reversed course on his state's reopening, effectively shutting down bars.
People want to be social. They want to interact, and that's why you're seeing it so much with the younger folks who, quite frankly, are at much less risk.
Florida and dozens of other states have reported a jump in cases from just 2 weeks ago. Delaware, Maine, and New Mexico are among others that are scaling back reopenings. No county in the U.S. has more COVID-19 cases now than Los Angeles. Richard Garay says he and about 30 members of his extended family caught the virus. His father died from it.
Our parents should die of old age. They shouldn't have to succumb to coronavirus.
The European Union says it will now ban most Americans from traveling to EU countries because of the dramatic increase in cases here in the U.S. Danya Bacchus, CBS News, Los Angeles.
Miami-Dade County Mayor will sign an executive order closing all county beaches for the July 4th holiday weekend through July 7th and possibly beyond. The order will also restrict gatherings of more than 50 people. In your Banking 671 report, don't be intimidated by pressure, threats, or confusion tactics of scammers who often use these scare tactics and coerce victims into acting quickly before they can look deeper into their lives. Never respond to threats and or demands for payment or your personal information. Learn about how legitimate businesses or government agencies might contact you by visiting their website or calling a number that you know to be genuine. That is your Banking 671 report, brought to you by the Bank of Guam and Coast 360. And that is your news.
All right. Thank you very much, Sabrina.
You're welcome.
Yes, Jason.
Hi, I noticed something because, of course, I have no life and I'm on social media like all the time over the weekend anyway.
We noticed that on your TikTok.
Yeah, that is not breaking news. Thank you, by the way, for retweeting my TikTok, Chris.
Right on.
I appreciate it. Someone who is on social media and apparently is now back on island, Guam's own Pia Mia.
Right, I saw that.
She was on her Instagram story. She was on Snapchat too, and she's back.
Well, welcome home.
Right, yeah. She was going all around, and people kept asking, is she in quarantine or so? I don't know. We'll find out, I guess. Right.
Yeah, but a lot of people were talking about that, and they were like,
yeah.
"Hey, she's here now." So
maybe we could get a special performance.
No. That's what I was wondering. Do you guys happen to know? Is she back for like a benefit show, or like she's doing a gig?
I don't think there's any organized, or I don't think there's any events that are supposed to be happening.
And if it was Zoom, you could just
yeah, maybe that.
Well, we'll find out.
I actually did reach out to her on her Instagram, but she must get so many Instagram messages I had reached out to her when we were doing the Stay Home Live Local Fridays and asked if she would be willing to do a performance. But like I said, she probably gets a lot of messages.
Yeah, probably.
Yeah.
I mean, I would have just think that, maybe she would know what's going on in Guam and kind of like volunteer to do one maybe.
That's an interesting discovery though, because I just saw that pop up, and it's the way social media work is like, oh, if someone's posting that's near you, I was like, oh, why is Pia Mia showing up on my thing? I was like, oh wow, she's back.
Yeah, I think she saw her coming out of a Payless or something.
Yeah.
Oh wow.
Okay, 6:51. Let's get Dr. Peter Lombard on. I don't have a lot of time this morning, but Doc, you're crunching COVID numbers, and you finally got some numbers, unfortunately, to crunch. Last week. So I guess just real quick, what's your take on this latest spike and surge with COVID-19 positives on island?
I'm trying to kind of wrap my head around how we can go from 14 positives in one day of about 300 tests to over the next 3 days we did 850 tests and only 3 positives, and that discrepancy is just kind of hard to rectify, especially when you know that we're testing the contacts of the positive tests that we were getting. So I think that certainly some of these positives we're getting are actually what's termed as a repositive. And if you look at Korea, they're doing a really great job of looking at these repositive tests. So just like I think one of our first cases in Guam, if you remember, he just kept testing positive over and over and over again. And so this phenomenon of testing positive and seeing, maybe old dead virus is not actually infective is not a new one. But last week, Korea, they looked at about 200 of these people, and they contact traced about 800 of people that were in contact with them, and none of them were infected by these people that were what's being termed as a re-positive. They also estimated that 50% of people who test positive for the first time will test re-positive again sometime within the next 2 months if you were to test them again by PCR. So that's a pretty astounding number. And so you have to wonder if some of the new positives that we're testing were infected previously but never had symptoms enough that warranted them getting tested at the time. And now they're now one of these re-positives. So that might be an explanation. It still doesn't, other than just a statistical anomaly on that day of 14 cases in the community where none of them are really related to each other. It still doesn't necessarily explain that. I just have to chalk it up to statistics. You're going to get some days which just don't make a lot of sense compared to the other ones because, as from what the governor said and from what we're hearing, there's really no relationship between these 14 cases to one another or to any cluster.
And that's why they were saying they're very concerned about them.
Right, and so that's why these last 3 days are, huge sigh of relief for me. And looking at the hospitalizations we had one at the end of last week, and I think now we're down to none. So that is just fantastic news. And that's, if you look at the last 2 weeks, we've had almost 60 positives. 60 positives, that's pretty much as many as we had the previous 2 months. And so if our new normal is one hospitalization for 60 positive cases, and when that positive mix may be new and old, then I think that's a useful number for us to think about. Because if we're not going to overwhelm our system with 50 positive cases, we're not going to overwhelm it with 100 positive, maybe even 200 positive. It's only 4 admissions if you kind of think of it like that. So I think there's a difference in the way that the virus hasn't changed. It's still going to affect people the same way. But I think that the way people are being infected is different, and it could really be primarily just due to mask use. The amount of virus that gets inoculated in somebody's airways is much reduced, and maybe that is the reason why we're not seeing as much severe disease. And the demographics is shifting, as you know, we're seeing this all over the U.S. Cases are skyrocketing, but the demographics of the people getting infected are people that are much younger. So we know that they're going to have less severe disease. And I also think probably in the U.S. as well, and they probably don't wear masks quite as well as we do in Guam, but probably the viral inoculum is going to be less. We are starting to see a little bit of an uptick in deaths where, we weren't seeing it. We were seeing this big divergence in the U.S. of cases skyrocketing, but deaths continuing to go down. But the past 2 or 3 days, we have actually seen the deaths start to flatten out and rise a little bit, and that is concerning for the U.S. for sure.
Right.
And in Guam, hopefully we don't see that. But deaths have to follow hospitalizations, and we're just not seeing the hospitalizations, and so that's very good news for us.
Doc, and saying what you said about having these 14 positives out in the community, and then we did a bunch of mass testing and not yielding the kind of numbers that maybe people thought. Do you think the government reaction to these positives is warranted? Delaying the opening of tourism, rolling back some of the quarantine measures?
It's conservative, and that's probably smart. I think at least until these 14 cases get a week out and you can see if they're going to turn into hospitalizations or not, I think that's smart. Now, what we might be able to do in case this happens in the future is say, well, what is the demographics of that group? If they're all under 50, then we're not going to worry about it. If they're all over 50, then that would be something more concerning that might want to trigger some sort of change. So I think we're dealing with different types of infection, of people being infected with COVID now than we were in April and May, and I think that matters when it comes to what we're willing to tolerate, when it comes to the risk to the general population, the risk to our susceptible population in particular. I think we're doing a better job of protecting our elderly, and so I think that matters in terms of how of policy, and that might mean we're willing to accept a little bit more risk to again to start bolstering the economy a little bit better.
I wanted to ask, what are your thoughts on the new quarantine protocol that goes into effect on July 1st after midnight, with the 72-hour pre-arrival PCR test, and then the other option of for those who are on home isolation to be able to test out after 7 days?
Yeah, we've been talking about this on our physician chats quite a bit. It's definitely a conservative, safe policy, and if that's what is most important to most people, then I think it'll be accepted by most people. The safest would be to do 3 tests, one before, one on arrival, and then one 5 to 10 days later. The next safest is 2 tests with some sort of quarantine, and then 1 test is obviously less than that, and no test would be obviously the highest risk. But so 2 is kind of in the middle. It's still pretty conservative. You're still going to catch quite a bit of folks that become positive as they're traveling, or right before they travel, or within the first couple of days of travel. You still are going to pick those up. Now, but again, it comes back to what is the nature of these infections, and how risky are they going to be to the community? If they do result in a couple transmissions, and it's within a patient demographics that we can tolerate, then maybe we can actually live with that. So I think we need to. It's a tough sell anytime you're trying to relax restrictions too much. You're going to get detractors on both sides. So the ones that want to open things up more are going to be upset with how restrictive this is. But if you start to pull back, you're going to get people think it's crazy. How can you let more virus into the island? So it's a tough position that the administration's in to try to come up with something. So I think the one they have is conservative, but given the recent positives, I think that's okay until maybe another week or 2 go by. But and they seem to be very willing to change and adopt the strategy according to new information and what we're learning about the virus, which is great.
Mm-hmm. What about what are the physicians in these chat groups saying about because of these increase of spike in the cases of confirmed COVID-19 cases? Are any of them saying that maybe we just opened up a little too early?
Surprisingly, no. We're not really seeing that at all. I think more the sentiment is probably that we need to be a little bit more relaxed about opening things up. I don't know if that's surprising or not, but people are kind of trying to. Nobody knows exactly what's happening out there, but we're trying to read the tea leaves and put the different pieces of facts together. You got to look at some people were making drastically wrong predictions months ago, and some people were a little bit closer to reality, and maybe those are the people that have a little bit better sense of how to put everything together.
Well, we're going to be talking to Dr. Cabrera in about 30 minutes or so. So if you want to listen up to that.
Yeah, thanks.
Yeah.
Certainly will.
Okay, Doc. Appreciate your time this morning.
Okay. Thanks
All
a
right,
lot,
take
guys.
care.
Okay, wash your hands.
Bye-bye.
Bye. 701. That's Dr. Peter Lombard. Interesting perspective there, saying, hey, we had 14 cases all over the island, and then the mass testing that we conducted didn't yield the type of positive numbers that at least he thinks would indicate a serious surge.
Yeah.
What are you looking at, Bree? Bree has got the situation report from Public Health up. Anything interesting there?
No, it wasn't updated. So I'm just going back through the numbers and just looking at it.
This is a great resource, guys. If you go onto the Public Health website, I think it's dphss.guam.gov. They have a situation report. The Joint Information Center releases a little bit light on info, if you will. It's kind of like the Cliff Notes version of the situation report, which has a breakdown and they do the isolation, hospitalization statuses,
the demographics, and so when you get you get the Joint Information Center, then you compare it to the situation report, and the situation report just provides more details, but you have to have compare it to the previous day's situation report.
And then you have to notice the differences.
And you have to do the math and stuff. Yeah. But the crazy thing is that you actually have to physically print out the day before situation report and just keep the file going so you can make the changes, because there's no way of going back online for the previous day's situation
and then they don't track the increases on each day's new report. In terms of this went up by this many.
Right. It just gives you the number, whether there was confirmed contact or contact tracing, things like that.
And just so people know, I mean, this is a resource that anybody out there in the public may access. I mean, we do it, and it's at dphss.guam.gov. They update it around, lunchtime, around 12 or so?
Between 11 and 1.
And I know so, I mean, if you guys want to do your own analysis, you can absolutely get on that too. But I think I was
going to say, it doesn't indicate what Dr. Lombard was mentioning about whether or not an individual retested positive, right, for COVID. But that would be interesting if they did include that, so that we could track that as well. That might be a good question for Dr. Cabrera.
Right. Yeah, I've kind of wondered about, because you, Chris, were just talking a minute ago about, what a lot of people seem to be fixated on these days is the rate of change from day to day. When that one headline came out and it said, Guam's got a 410% spike. It's because we went from 0 to 41. The state of Florida has had 8,000 cases a day for 3 straight days. So their rate of change is basically 0, but they've got 24,000 cases in a weekend. Yeah. So it's like how they say, there's stats can be. I mean, what Pete's doing, and we had his Twitter handle up there. And if you guys want to actually follow Dr. Lombard and everything, he is doing phenomenal work on Twitter. He's on there all the time, analyzing stuff, retweeting interesting links, offering perspective and everything. There's a really, really good Twitter account to follow.
Right. What a lot of these voices though are saying, the kind of the consistent theme is they're talking about wearing the masks. And how wearing the mask may be key in the type of spread we're seeing with this virus. So I think it's important that we keep wearing the masks. I don't see what the big deal is. I mean, if you don't want to wear a mask, then you go off in your own little area and stay there and talk to the other people who don't want to wear them. But, got to wear the masks. Got to be safe. Bree, 4th of July weekend coming up here.
I know.
Do we need to? Do you think the government needs to issue any kind of hey, take it easy, guys, on the beach? Because that's something people were talking about is the reopenings. Remember, we reopened and they were going to do the testing component, and we did see that surge. What do you say? 60 positives in the last couple of weeks, and we've had that same amount in the last couple of months. So, hey, we're going to take a short break at 7:05. We do have the interim Guam Visitors Bureau President, former Governor Carl Gutierrez coming up. And then we're going to play a couple clips from this press conference that happened Saturday. The KUM News team were able to ask the governor her thoughts on I don't know if you call it a reshuffling, because there's some cards that have left the deck. So we'll talk about that and get the governor's reaction at 7:06. Hey, there's some openings, though, guys. We should post those up. I don't know if they're going to use the filing cabinet full of transition team applications, but there's definitely some vacancies in the administration. Jay?
And honestly, I can't type that fast to get like all the graphics up for like all the openings, like just in the past like 4 days. So
right, maybe they'll do like an infographic and we put it out now. Hiring.
That's its own situation report.
Yeah. Good one, Jay. 7:05. We'll take a break. Come back with more of the KUAM news containing COVID takeover. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus, gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
It's not always easy trying something new. Sometimes you have to help your loved ones along. Nana is so used to her weekly trips to the bank that going online can be a little scary for her. But her grandson knows that banking online is safer and easier. So he's teaching her how to get started using Bank of Guam's online banking videos. Teaching is one way to show our loved ones we care. Keep your family safe at home and show them how to bank online. Find easy-to-use online banking tutorials at bankofguam.com or on our Instagram and Facebook pages. Bank of Guam, member FDIC.
Matagui familia ku Tutulong manubatu Sinanahu hatagi loti huoski Za 21 tugi presu Kisina humutu Asa guahali natihu Tati sina maregla li natihu Sa guahatu mobi Alam dia sempre
21 in prison. JD Crush containing COVID. It's the KUM News Takeover of Guam's favorite on the 29th day of July. Lots to talk about this morning, so let's get right to it. They're scheduled to reopen tourism on Wednesday, but, oh, well, Mullard. Sorry. And so we wanted to bring on the interim president of the Guam Visitors Bureau, former Governor Carl Gutierrez. Thanks for joining us this morning, Governor. Good morning.
Good morning.
Good morning, everyone. Good morning. Morning.
Sorry, I know you're jamming out to that JD Crutch. I didn't mean to cut it off there.
Oh, yeah. I'll tell you what, man. That makes me move.
Gov, so I guess just first of all, your thoughts, your feelings on this postponement of the reopening of tourism, because I know you're working pretty hard on this. So what are your thoughts this morning?
Well, first of all, just to recap, we were going to lift on July 1st, the tourists coming in, but and we were expecting on July 2nd the first flight from Jin Air, carrying mostly returning residents and some long-term tourists, but also maybe a smattering of field tourists. And they were supposed to arrive here July 2nd. However, last week we were informed by Jin Air that that's not going to happen until July 23rd. So, moving the date, not lifting the date on July 1st, from an airline standpoint, that we really no harm done. But of course, the local people here, the restaurants, the hotels, they were in the process of preparing themselves, to start practicing the receiving of tourists, and it just, it was a good learning process that we could be going through. And so hopefully now that it's been not lifted on July 1st, we're hoping that the governor and her advisors come up with a July 15 date. Then that way we can start our planning again.
So that's the date that you want, Gov, is you want a July 15th reopening.
Yes. If we can appeal to the governor to look at that date, and we've got to do something with our industry here. I know the governor has public health concerns, and it's an awesome job she's doing that we can't second guess her. But hopefully we can give her enough information that Guam needs to open up our 65% contributor to our economy, and that's the tourism part. So we know that's pretty high, and more drastic things could come by continue having unemployed people out there and businesses going out of business.
Gov, if you had your way, what would your protocol be for the incoming tourists as far as testing for COVID-19 goes?
Well, that's out of my lane. But what I'm saying is that if it's true that most people will not travel, if there are to be tested leaving their country, coming to Guam and get tested, and then getting tested when they get back, I doubt how many tourists are going to come with that kind of protocol. And there has to be some kind of middle ground. And that's exactly what I'm asking the governor and her advisors and the doctors' advisory group to think of something not onerous, where we actually, throw the baby out with the bath.
Mm-hmm. Gov, how many tourists are you anticipating to come to Guam? You said July. You were saying July 15, Jin Air. I mean, how many?
July 23rd, Jin Air.
Okay. I mean, just
not many tourists. I think that the that's going to be maybe 10% if to the end of the year, or 20% if the other airlines open up September or October. But that's all we're looking at. And as I stated, I think it would make good sense for us to be able to get a low number coming in the beginning, go through our different protocols at the airport, the hotels, the restaurants, and everywhere else in the community, the beaches, and that we see that our protocol we set here, not so onerous, will be able to continue to allow tourists to come in thinking that they're not going to be going through this hoops that they have to jump through, especially the one that will hurt them is being tested when they get back home.
Gov, what does this do to all the plans that we had to prepare for the reopening of tourism? Like, for example, the cleanup.
Well, hopefully what has transpired over the weekend with hardly any, if there is one testing positive, that we will begin again to replan and get back out to do it. Some people continue to do theirs. I guess they didn't get the memo. And but there are other people that are really anxious to join up and clean up the island. Maybe not necessarily for tourists, but for themselves in the community.
Right.
Mm-hmm. What was your assessment? Because I've seen a lot of pictures and videos of you out and about visiting some of the parks and including some of the homeless people. And I believe in one of the videos I heard you talking with a homeless person down at Paseo, and you were talking to this individual about, this trying to get homeless people into homes. And one of the things that you said, which really kind of stood out to me, was that you told the homeless person that we're trying to find homes for them, and about this plan or this idea for 20 acres somewhere to build homes for the homeless.
Well, yes, I at one point I had that under my responsibility, but lately I've been told that for me to stick to tourism, and they have a task force for homeless, and I said, well, okay. Sounds good for me, but so far it's been a year and a half, and that homeless group hasn't done nothing.
Are you frustrated with the lack of progress, Gov?
For the homeless community, yes. I know that the governor wanted to move forward something quickly for the Paseo, but that was pulled away from her. But that group who has been charged with this thing, somebody's got to put some responsibility and urgency on these people, because what I was trying to do was solve the problem, long term. And also not only the homeless community, but those people that are up in the Tomorrow Land Trust that have no water, no power, no sewer, that in helping the homeless and moving up to an area like that, we could also help our own people that are pretty much homeless with just a lean-to that they're living under. So we can always merge these two processes together, so we help everyone. Mm-hmm. And because otherwise you're going to have a fighting between the homeless and those that consider themselves homeless as well, just because they have property, but their home is only a tent.
Mm-hmm. Gov, how difficult, Gov, is it for you? Because, when I think of Carl Gutierrez, I think of people helping people. That's the type of governor that you are. And so for you having to go out and and look at these parks and seeing all these homeless people, and the fact that there is still no solution to the homeless situation, and you're told to stay in your lane.
Yeah, that's got to be frustrating, Gov, because you've got the experience. And just knowing how you operate, I can see you surveying the lay of the land. Mm-hmm. And I know that, Governor Carl's saying I can help there. I think we can do this here. I feel like I would be able to offer a solution for this. But then to get, told, like Bree said, stay in your lane. How frustrating is that?
It's been 3 months.
Well,
We've
you
been
know what?
talking
Maybe
about-
that's another way that I can be more of assistance than actually being in the government. So I'm just looking at different ways to be able to help these poor people that I see, and most of them I know by name. Most of them are even my veteran brothers, and there's just not enough. I think emphasis is being put. The governor pushed it as much as he can, but I believe she put the wrong people in there.
Well, I believe the lieutenant governor has
Well,
been
it doesn't matter who's in there. Governor Gutierrez is just calling a spade a spade.
Yeah.
You're right.
Yeah.
I mean, Bree said the last 3 months, but I think you were key, Gov, when you said a year and a half. That's really how long, these people have been waiting.
The governor and the lieutenant governor put forth this solving of the problem when they first came in. And unfortunately, they thought everything was going hunky-dory with the group, but it just was not. And someone like me should be on top of it for them, because the governor and the lieutenant governor just have too much on their plate from the day-to-day operations, and then the COVID hit. So I'm not blaming the governor or the lieutenant governor.
Right.
I just think that someone should be able to step in for them to be able that have gone through this processes in the past and would know how to pull it together. So hopefully the governor will reconsider and allow me to sort of interact with these people.
Yeah, I mean, you're one of the people who hasn't resigned yet. Are you planning on resigning, Gov?
No, not planning.
Okay.
Not planning. After this phone call, I don't know, though. Gov, I mean, you got the experience, so if you could, just a little insight and your perspective on what's going through Governor Liu's head right now with all these resignations and, people retiring. I mean, people are talking about this. It's almost a massive exodus that we're seeing. So what are your thoughts on that, and how does she manage these shortfalls in personnel?
I think we're reading too much into that. I think these people are just ready to be able to retire. I think they were kept on by the governor to help her move forward in the new administration. And some of them, just decided that they're losing money by continuing to work and not retire. So I don't read anything into it. I think it's just their time to be able to move on with their lives.
So how does the governor manage these vacancies? I mean, I think you look at who you have, who's capable, one of those people being you, and you give them more responsibility, but that's not what's happening, is it?
Well, I'm sure that she'll maybe reconsider I don't know. I just don't know anymore. I'm just telling you that something's got to be done.
Right.
Mm-hmm. So you're saying that based on what you already have on your plate, you can handle and you can take on the homeless issue.
Well, there's a lot of staff at GVB, for example. There's 44 people there. And, we've got 3 countries we market to particularly. And the 4th one in the Philippines is hardly a marketed area. And I think that if I stepped in there and took my people with that have been working on this process for the last year and a half, that I can make it work from within my responsibility at GVB. But I think some of the directors there just don't want me to be able to be doing 2 things and just concentrate on GVB. But everything, even if it's an extraneous thing like homeless, it impacts GVB.
Yeah.
And so I wanted to work it from in there, but they want me to concentrate on GVB, and GVB is going to be impacted by the other extraneous things out there.
Right. I can see you're talking about the interconnection with the homeless and tourism and all these issues kind of intertwining, right?
And the chairman got letters from lawyers already telling, the GVB chairman getting a letter from a lawyer of the neighboring areas over at Royal Palm saying, hey, you guys got to clean this thing up or we're going to be all in court and all that stuff. So obviously they know it impacts GVB, and it's part of GVB's responsibility.
Wow. Feel for you, Gov.
Okay, well, thanks a lot, guys.
Whoa.
Wait.
So how are you retooling your plan to reopen tourism, Gov? Are you just moving everything kind of down the line a couple weeks?
This is our first day to try to tackle the new protocol. And so I'm heading there now, and I'm pulled over so that I don't get pulled over by someone else, so I could talk to you. But yeah, we're going to be discussing it today.
And what do you anticipate the discussion is going to be? What are you bringing to the table, Gov?
The first thing we're going to discuss is try to get a date of July 15th set forth, and the governor agree with that, so that we can actually plan instead of just guessing.
Gov, I want to go back to these vacancies and the resignations and retirements. Is there anybody out there that you see or you feel would be able to contribute to any of these vacancies that we have in the Leon Guerrero Tenorio administration?
Say that again.
Gov, is there, with these vacancies, these resignations, these retirements, is there anybody that former Governor Carl sees that could really contribute in any of these slots that have become empty over the last couple of weeks?
I don't even know who's going out already, to be truthful with you. So give me some chance to look at it, because I'm looking for people that really know how to get results out there, not just send out press releases and make people believe they're doing something. I want results for the governor. From the outset, I said, Governor, I'm going to get results for you, and that's all that matters. And some of these people are not results oriented.
Right. So we have the governor's legal counsel. Obviously, they plugged that opening at the airport. Public health. Anybody public health? You think that
Lori Duenas is
Lori Duenas is acting now.
No, I no, I'm not. I'm so immersed right now with
I see.
all the
Okay.
CDB. I don't even know who's retiring and who left. I know that I heard that DeNorsi did, and that Tom Ada did. That's the two that I know that have experience under their belt. So otherwise, I'm just going to go up to GVB and see where I stand.
He's like, otherwise I'm staying in my lane, guys. And I'm just going to stay in my lane.
Well, speaking of a GVB, where are we? I mean, obviously part of the plan can't just be we're going to clean up Tumon. What else long-term is the plan for tourism recovery?
Well, we have not gotten down to other details than to find the Washington, D.C. to remove us from the entire United States as far as protocols are concerned. We've been reaching out to make sure that Guam is Guam-centric, and that everything that we're in Asia, and that Asia, we're closer to Asia than to Honolulu, and that if we can get tourism guidelines and protocols from the COVID just carved out only for Guam and not included in the entire United States. That's one thing that we're able to let them know, that we are America in Asia, but international in flavor, and that you should not be treating us the same as any domestic place in the United States. And once we get that, I think that it'd be easier for us to be able to deal with other countries around us in Asia, in the Philippines, and over into Thailand, over into Vietnam, and opening up more tourists visa-free. And so I hope that Guam can be a laboratory thing for the United States to sort of use.
Are you working with Congressman San Nicolas on that initiative?
No, but I will because he's there now. But I'm just reaching in first to the powers that be in the Republican administration. And once they, I use the Republicans here in Guam as well. I speak with Juan Carlos Benitez and other businessmen to be able to get me the right people to speak to. I mean, it's about getting results. It's not about getting credit. But so that's what I'm working on, and hopefully that I can continue.
Okay.
Okay, Gov.
Thanks.
Thank you, Gov. Wash your hands, Kay.
And wear a mask.
Wear your mask. Make sure, Gov.
I got 8 masks in my car.
You're wearing 8 masks right now? What?
No, but I have to change it because, after a while, your breath just gets all over.
Thank you, Gov.
Thanks, Gov.
Okay, so there you go. Wow. It sounds like former Governor Carl Gutierrez has some issues with the way things are being handled in the administration. But you know what? Of course he does. Of course he does. This guy was governor for 8 years. He was, the legislature. I mean, of course he has thoughts.
Yeah. Hey, if he wants to tackle the homeless issue, man.
What are they doing? Like, you got a guy here like he wants to do. He wants. People are leaving you. The people don't want to do work anymore.
Yeah.
So you look at who you got and who can do it, and you say, hey, yeah, go for it. I mean, I don't know if I'm governor and Uncle Carl's saying, no, I can take care of the homeless. I'm like, pues, go for it. Go for it, dude. Please.
Siggy.
Siggy, go.
And like I said, he is the people helping people. That's gotta just be so frustrating to be the one to go out there to visit with the homeless people and telling them, hey man, we gotta clear out the parks and we're gonna try and help you, but he's being told stay in your lane.
Man, and he just threw all those people on that homeless council under the bus. That was like a sufat. It's like bam. It was like a judo. Boom.
Oof.
I just wanted to.
But he's always been that way. Tell it like it is. I know I've been on the receiving end of that, and I'm good with it.
How times have changed.
He's not the one that runs away, right? When you interview someone, he's right there, and he will answer the question. It may not be, the
answer you want to hear,
but he just tells it like it is, and you're like, thank you.
And Bree, you've been covering Carl and his career, in all of its, various iterations for what, 25 years now?
Well, I got here in '96, so since I got here, I covered a lot.
And that's the point I wanted to make, because if anybody dared even thought to tell Carl Gutierrez, stay in your lane, maybe about 20 years ago and everything like that.
Well, I guess
there would be a couple people blowing up your phone.
Yeah, but I guess Governor Lilian Guerrero is that lady who can tell him to stay in his lane. Mm-hmm. But you see, I could hear he's frustrated that he really wants to help and he doesn't understand why he can't.
Yeah.
And I don't know. I mean,
because they are connected, like you said.
Yeah.
But he's not trying to make any dissension in the ranks, and he's saying, hey,
he's not trying to make any dissension in the ranks. I don't think you're right. I don't think he's trying, but with that phone call, I think he did.
He's saying I work for the governor.
And somehow they're gonna flip it on us and be like, damn KUAM. God, if they weren't asking, hey, we had to get him on. Mm-hmm. And
But he really stood up. He stood up for the homeless people in that interview,
which is so refreshing.
Wow.
I mean, it's so refreshing, and I'm just not seeing that anywhere else. No one else is standing up for them. We're reporting on it. The homeless people obviously felt like they've been kicked to the curb, and they have been. They're sleeping on the curb. And when I heard the governor's response to the press conference Saturday, I swear to God, I feel like you could take that response and just copy paste it to the last 5 press conferences. Yeah. She's been saying the same damn thing for the last 5 press conferences. I don't want to just put them up in a house. Well, why don't we just start there? Why don't we just start there? What's wrong with putting them up in a shelter? But it seems like they don't want to put them up in the shelter until they have the services, until they have the employment services, until they have
couldn't find anybody willing to
or they couldn't find anybody connected. They couldn't find anyone who was in. We don't know because they're not saying. That's the problem. Is when you have a vacuum of information, people will just start saying things. Mm-hmm. So we had heard last week, for sure. That's what the deputy at DPW said, for sure, guys. Lieutenant Governor, I think he said 2 weeks ago.
No, he said, 2 weeks ago, he said he should have a answer
by
on
the
Monday.
End of the week, right?
But on Monday, which was Monday of last week.
Yeah. I don't know. I mean, at this point, it's sad to say, but I'm just not even surprised anymore. Like, I might have a heart attack when they announce that they have awarded the bid for the shelter, because at this point, I think it's clear. The writing on the wall is clear. The homeless, it's not a priority. Sadly, it's just not a priority for this administration. It just isn't. I mean, going back to the drop-in shelter that was supposed to be at the old legislature building. We had plans to use that as a drop-in shelter. The need for it is great. Gotten you homeless. Tremendous numbers. Mm-hmm. And they said, no, we don't want it. We just want to have offices there, for more GovGuam offices, for more deputy directors. And they scrapped those plans. And now here we are. Homeless people can't catch a break, can't get a roof over their head. And it's just more frustrating than ever, because, it just seems like nobody cares. That's what it seems like to me. And we've seen where the government of Guam can use superpowers to get things done. But in this instance, I guess because they're just homeless people, there's no real rush. And all we hear is, oh, they didn't do that. Oh, they didn't do that. Oh, we didn't hear that when they were using the emergency superpowers. So why don't we just use the emergency superpowers again?
There's guidelines and rules, and
I'm just saying, you've already shown that you could do it a certain way.
I mean, for like a homeless shelter, that's what
Right.
we've been hearing.
Yeah.
I got to see these guidelines and rules.
I mean, Jesus, what kind of guidelines are we talking about? But, you know, at least to me, in talking with former Governor Carl, you can say what you can about him, but I just think it's refreshing that there's someone in the government of Guam who is calling it like it is. Because everyone else is tippy-toeing around this, you know?
That was a refreshing to hear. You're right.
Yeah.
And what completely unexpected.
Yeah. Because I mean, I'll be honest with you guys, Governor Gutierrez is worried about overshadowing Governor Liu. I mean, it's an interesting dynamic, and that's part of why they never called him up, is because there were people who were advising Governor Liu that, oh, if you bring in Uncle Carl, he's going to overshadow you, he's going to work around you, he's going to go behind your back, he's going to do this. And maybe those people were one of the people who resigned, because there's obviously been a change where now Uncle Carl has a seat at the table. But you know, the problem with Uncle Carl to some people is he might be sitting in this chair, but he's going to want to sit at that one and that one too.
Mm-hmm.
And I think it's good. Hey, if the guy wants to do the work and solve the problem, let him do it.
You know, one thing that you mentioned, Bree, was you said that he is a very hands-on. He was a very hands-on executive when he did it. And the one thing that I know in the years that we've covered him and everything is he always said we have to run Gov Guam as a business. That is one thing he said every single time when he was the governor, when he ran for governor again, when he tried to get back into public politics and everything like that. So he always just says, if this was a private entity, we just get the money together, have an A-team, organize, and solve the damn problem.
Right.
And that basically he's always just said that. He's like, if this was a business, we just get our act together and go fix it.
I don't remember if that's what he said, but I do know that if he sets his mind to something, it will get done. For sure.
And well, that was a soundbite he gave us on a number of occasions. Like, we have to run Gov Guam like a business.
Right. So, yeah, it really was interesting to hear him talking about the people in charge of settling this homeless situation. And he wasn't just referring to the past several months since COVID happened. He was mentioning for the past year
and a half.
Right.
Yeah. So that's good. Maybe, you know what, though? Sometimes you need your uncle or your elders in your family to just chew your ass out so that you do your damn job.
Mm-hmm.
So hopefully, the right people got their asses chewed by that phone call from Uncle Carl, and they'll get this done. Get it done. We had a comment here. They can't get or make money from the homeless, so no superpowers for them. Sad. It's costly. No profit from this project. That's Uncle Carl working for the people and the homeless. Yep,
In
Carl's
the video
always helping.
In the video and the pictures, I have to say, though, I didn't see him with a mask on when he was talking to people.
Right.
Somebody also jumped in our comment stream, and they were saying, didn't Lieutenant Governor Tenorio say that he was working on a plan that was kind of like to emulate what Hawaii is doing?
They said so much. I lost track.
Right, because he had. I remember he was on a trip, but this was pre-COVID.
Yeah.
He went on a trip and he toured the homeless area in Hawaii, but again, that was pre-COVID.
Mm-hmm.
But he's been the one that's been talking about. I thought he was the one in charge of this whole homeless situation, the plan for the homeless, and then, but we haven't seen anything. And I want to say that the governor in one of her press conferences months ago said that he was tasked to address the problem or address the shelters.
Bree, if we went back and collected every soundbite from every press conference about this homeless, it would just be so embarrassing for the administration. Mm-hmm. It's embarrassing. It's embarrassing for a Democrat administration who is supposed to, their bread and butter is supposed to be taking care of those less fortunate. You know what I mean? The social programs, that's supposed to be the bread and butter of a Democrat administration, and they're just failing on so many things that are just you would expect from Democrats. 7:40. We're going to switch gears just a little bit here. And there were some major changes that came out with the protocol for quarantining of returning residents and travelers inbound to Guam. And we wanted to bring on, I like calling him Dr. Doom, from the Governor's Physicians Advisory Group. That's actually a compliment, Doc.
Okay.
Dr. Felix Cabrera. Doc, good morning. Thanks for joining us.
Good morning, Chris. Good morning, Bree. Good morning, Jason.
Good morning.
I mean, you were the guy that they go to, like Mr. Presentation. And so you had your time to shine, the press conference Saturday, where it really looks like the Physicians Advisory Council worked hard on revising, right? Because it's not a rollback, revising these quarantine procedures. And this was all relative to the surge that we saw last week. So, Doc, we'll go ahead and give you the floor. If you could just talk about the conversation that went into changing these protocols.
Yeah, sure. To be honest, this has actually been a process probably in the past 2 weeks or so that we've been working towards. And, it started, of course, with trying to understand how to safely reopen tourism based on the trends of the cases that we were seeing at the time, and how we can actually make this possible. So there was a lot of work in that. But then in order to do that, that meant that was going to affect how we were, performing our quarantine and testing and isolation and tracing program overall. Now, that being said, we were moving toward, we actually had a pretty good proposal, and a lot of the work was put into that. And then we started having these increased cases of not just within DOD, but then also within the community, especially at the end of last week. And so that changed everything overall. And then we felt that there was more urgency in implementing the other part, which is the high risk areas and medium risk areas, for example. And how do we implement that part of the quarantine program right away? And so that's where the shift really went into in the work, probably the 48 hours prior to Saturday's press conference. And so the focus was more on that part, and so that's where we are today.
Mm-hmm. Why did we shift from hot spot to high risk designation?
Well, one of the important things was to understand why we were making the changes, and everything is, we say this multiple times, that everything is risk versus benefit. And so let's actually just focus on what we're actually talking about, the risk. And when we talk about quarantining, people traveling into Guam, it's about the risk of what is, their chance of bringing in new coronavirus to the island. And so, we said, let's focus on that, and let's not, focus so much on the buzzword of a hotspot. And so by actually calculating a risk score for this area, then we make it more objective. And it's something that can, if ever challenged in court, can hopefully stand up in the court of law, that we were using objective measures to name these particular locations. And part of the call was that saying, hey, how come we're doing this for some areas, but then the whole country looks like a hot spot in and of itself, but it's more complicated than that. Mm-hmm. And so we had to look at things state by state level. We looked at it even county by county, but then that became too granular and actually was becoming even more unfair how we would risk stratify them. So we settled on just looking at just the states themselves. And I think that was the more uniform data that was coming out from at the state level that we could trust and that we can use it and make a better assessment with.
Mm-hmm. Can you explain the change also in the new quarantine protocol for the 72-hour PCR pre-arrival test? And, before, I don't think it was a PCR test, because the PCR is the blood test, right?
No, the PCR is the nasal swab.
It's the nasal swab. So,
yeah.
Serology, that's right.
Serology is the
right, the blood test,
yes,
right?
Yes. And so the key thing, again, PCR tells you about active disease, where serology only makes an inference on past disease or potentially more recent disease. So PCR is always the standard that we look at in terms of if we're trying to understand somebody's risk of actually having active disease.
Mm-hmm.
So,
right.
So that's the part there.
Okay, and so if you could just kind of break that down, what's going to happen for anybody that arrives after midnight on July 1st?
Yeah, and so basically, the first question is, are you originating from a COVID-19 high-risk area, an area that's listed? And if you are not, then you automatically go into home/self-quarantine. And so just to be clear, everybody goes into quarantine when you arrive. The question is just where do you undergo your quarantine? So if you're not coming from a high-risk area, you get to quarantine at home. If you are coming from a high-risk area, then the next question is, have you had a negative PCR test less than 72 hours prior to arriving on Guam? If you have, then that means your risk is now decreased overall. And so then therefore we feel it's safe that you can also quarantine at home. But if you don't have this test done and you're coming from a high-risk area, then the way that we mitigate that risk is that we actually hold you in a government facility quarantine. And so that's where the risk mitigation part comes in. Now, here's the part of I think that some people may be confused about, but I want to make sure it's clear is that, again, wherever you're quarantining, either home or in a government facility, in either situation, you do have the opportunity to test with another post-arrival PCR test and to see if you qualify for an early quarantine release. Again, another step in risk stratifying traveler coming in.
Right.
So if you've had this negative test before you came in, and then you can actually retest on day 7. And then if you don't have that test at all, then we give you the option on day 10 to test. And again, this is subject to testing availability, which is a whole different concern. But say you have that negative test post-arrival, then we feel comfortable enough to let you release from quarantine. That means even at home. That means you're not restricted at home anymore. You can go about. But everybody must fully comply with the 14 days of symptom monitoring and tracking with public health. And so that's a program that's part of that, where you have to check in daily and ensure that there's no new developments. Mm-hmm. But we also have a pathway that if somebody doesn't want to get tested, they refuse to get tested, either pre-arrival or post-arrival, then that's fine. That's your right. You don't have to be tested, but you do have to finish the full 14-day quarantine, either at a government facility or at home, depending on where you started out at.
Doc, will public health still be able to grant quarantine exemptions for essential workers or for residents with hardship circumstances?
So I want to be clear about that. So just to be clear, nobody is granted exemption from quarantine per se. What they are granted is restriction of movement ability, so that if you are here for an essential purpose or here for a hardship, that you can qualify for restriction of movement where you are allowed to go to where you need to go, but then you still have to come right back to your place of quarantine. And so that needs to be the clear part there, that you're not, if you're on quarantine, you're not to be anywhere else, aside from your house or your place of business or the place that you need to go to. That's part of the reason that you're essential or you're here for the hardship.
Doc, I don't know why I almost keep calling you Gov, but Doc, let's say that, Guam is small, right? Let's say we know somebody just got back on island and they're out, at the grocery store, out getting coffee. And, in the day and age of social media, you can kind of keep track of who was here, who wasn't. So in the event people see this and they kind of wonder, like, hey, is this person supposed to be on quarantine or lockdown or what? What is there, like a snitch line or something they can call?
Well, I don't know to that detail.
Because you recommend that people do their part, because
absolutely. And
right.
The thing is that that's the other thing that the Physician Advisory Group has been really advocating was the enforcement of these fines that are right now in law. And that if you violate your quarantine, then it's $1,000 fine. And that's, there's a reason why that's there. It's because you're putting the public at risk. You are endangering the public when you violate your quarantine orders. And so that's the key thing there. And Hawaii's had no problem making examples of certain people who break these quarantine rules. And so, in our conversations with public health as well as with the Attorney General, we say that, hey, this is to be serious, and people need to take this extremely seriously. If you're in quarantine, it's not just they're not really watching me, at home. I can sneak out and go. So you are seriously putting the public at risk, at that point. And because of that, just like if you're driving home drunk, that we have no problem arresting you and no problem putting you in jail in that situation and potentially getting fined. But in this case, we should treat it in a similar fashion. And that's I know it sounds harsh, but this is serious. People's lives are at risk.
Right. Doc, just for clarification, this 72-hour pre-arrival PCR test, it's not a requirement for people who are coming in. It's just that if you take it, it just determines whether or not you're going into a government quarantine facility or home quarantine.
And so it serves two purposes. One is that it can, if you're coming from a high-risk area, it determines whether where you might quarantine. But it also serves in potentially getting out of quarantine earlier. Again, so it qualifies you to get that 7-day test post-arrival. And so because of that, there's two incentives to potentially get it. And we highly, highly recommend that people get it before coming. And one, for your own peace of mind, but number two, for our peace of mind, and that you are now at a lower risk. Now, it's not perfect. There's still a chance that you may have it. So that's why there's all these other, there's a variety of safety nets put in place to try and reduce that risk.
We talked to Dr. Nguyen last week about this possibility of testing out of quarantine. Can you confirm or re-verify that the cost for that testing out, it's going to be borne upon the person on quarantine?
So that, I think, part right now as it is that I don't think there's a final decision on that part yet. And right now, until stated otherwise, it's on the shoulders of us, of the government. And so until it's specified further, and that I think is going to have to do with the resources. We have a fair amount of resources, and we can actually do these tests. I don't think there's going to be any pressure to start charging. But if all of a sudden the demand really goes high and everybody wants this, day 7 or day 10 test, then that may have to change, and then there may have to be a nominal fee that goes with that. For example, in the CNMI, when they were doing this, I think it was around $50 to get this the post-arrival test to test out of quarantine. And so, if anything, I think it would be subsidized, but it's not it's not something that insurance is going to cover. I think that's something that's clear if they're asymptomatic, because this is serving a different purpose overall.
I had a question from one of our viewers. It is the summertime, and we're going to see a lot of kids out there. One of the questions is kids camps or practices safe for kids to do right now or in the next couple weeks with the spikes? I know other people are doing camps right now.
Yeah, so they have to adhere to a pretty high standard in order to run these camps, and in a similar way that schools will have to be run in some ways. And so with these extra precautions, I think that risk is actually pretty it's pretty similar to just going to the park, for example, going to the beach and on a Sunday. So I think you're getting to that certain level of risk. So I wouldn't I don't think that the numbers as we're seeing them now warrants us to really clamp back down. We're not going back to peak quarter one. At this point in time, there's nothing that's telling us to do that. So I would say that as long as that plan is in place and it's something that public health is okay with, then really, please, I think people should not be fearful of moving, especially kids. I think kids are, thank God that they're in a different risk category overall, and that their chance of spreading it to each other and really getting sick from it is much lower than the adult population.
Right, and I think it was Dr. He was on our show a couple weeks ago, and when we were talking about this pilot project with the Japanese school,
yes.
And he was mentioning how based on their research with, I guess Dr. Berg was also a part of this, that children weren't believed to be super spreaders or something like that.
Yeah. So that's right now what we're seeing, and I saw some during our last PAG meeting, they were showing some video and the slides of how that pilot program's going on, and it looks great, and it looks they're really doing well with that overall, and I think it serves as a good model for other schools and programs.
Have you guys had any discussions or concerns about what's happening with the Department of Corrections with the 2 positive cases, and then we just heard about the positive case with the police officer over at the Dededo precinct.
Mm-hmm. Yeah, so of course, that's a population that we're that we be very concerned about in terms of the DOC prisoners, and the key part again is that that's a very close system, and it's distancing there is not the easiest thing to go about, and it is a major concern, and that's what we're seeing in a lot of parts of the country, that these are where a lot of the major outbreaks are happening, and these and the parts of risk mitigating them is takes on a whole different level of complexity. So we haven't looked at, we haven't had a report from public health in terms of how that is evolving. And so, but, once they do enough of their testing and contact tracing, I think that we'll get a better picture.
We do have another...
Yeah, I got it here. If a family member of mine traveling from Philippines having a negative test within 72 hours, he or she can quarantine at home?
Correct.
Okay. And then I got my son is in Oregon, Doc, and I just saw you guys have designated Oregon as a high-risk area. So what does he need to do to come back and go home?
Well, if he wants to come back home, he can do nothing different and come home and go into government facility quarantine. That's technically an option, but then the ideal situation is that he does also try and get a negative PCR test done within 72 hours prior to traveling, and so that he can have the comfort of quarantining at home, and then instead of getting stir crazy for more than 7 days, then then be able to test out on after day 7.
Doc, so when my son, let's say whenever he goes home, he's in the home quarantine, is he allowed to go out and get coffee or go to the grocery store or go running or anything?
Absolutely not.
Zero. Can you say that again? What are you allowed to do when you're on home quarantine in terms of leaving your house?
You're allowed to stay home. And that's really it. That's what home quarantine is. The only time that there's any exception to that is the special circumstances that were discussed if you applied for because you're an essential worker or because you're here for a specific hardship. And then even those times that you leave the home during quarantine it has to be very specific to that, and that has to be reported to public health, and as part of the communication line. And so if you're not here for any of those reasons, quarantine is quarantine. You stay home. And in fact, we recommend additional layer of protection that those within the same home also have some sort of measures within the home to isolate as best as possible.
Okay, that's good to know because my connect to public health is retired.
That's it, though, right? And take the end of this week.
That's it. I got to make a new connect. Thanks, Linda. Just kidding. Yeah. What's your take on that, Doc? I just got to ask. Are we driving the car? Are we okay with someone else behind the wheel? What are you going to say?
I think we're okay. I think everything is the communication line has been there. The knowledge base has been there in terms of that's why there's that's why it's important to have deputy directors. That's why it's important to have other people lead different parts of this. And so and so in us working with the rest of the team, I think there's a good continuity with this. And so Linda's going to be greatly missed, and she's been tremendous in this process, and Guam owes a tremendous debt of gratitude to her, particularly for standing up during this crisis and doing what she's done. And there's so many things that we'll never understand what she's gone through and been able to do for us. And so she's a hero in my eyes, and I think that we all should look at her in the same way.
Right. We miss you, Linda.
Yeah. And so the other thing I just want just real quick last thing again is just to understand that the physician advisory group, we're very sensitive to the needs of the island in terms of the tourist economy, and so it was not an easy recommendation to say to hold off on the tourism part right now, and that we are still looking at it very, very closely, and in fact we already have a plan in place in terms of how this quarantine part may evolve towards once we open up. And I know former Governor Gutierrez mentioned about July 15, and I think that's okay to look at that date. let's give something to look at.
I mean, is that what they're looking at? Is that what you're telling us, Doc?
No, that's what I just learned that from the call earlier.
Okay.
Yeah, and from what he said during as I was listening in,
Yeah.
and that he said let's shoot for July 15th. So like, great, that's fine. That's 2 weeks later. I think there's time for us to look at that and let's see what that means in terms of data. And the past 2 days have been reassuring. And so we'll take it from there. And so let's always first have a date to look at, and then if it doesn't look reasonable, then we won't do it. But if it does, then why would we not look at it that as early as 2 weeks? And I think that's fair.
Can you tell us anything else about these airmen, Doc?
I don't have anything else to share. I think than what's been exhaustively shared already.
Okay.
With it, and so again, it's just one of the last point. I'll just make is that what's the concern really is these non-cluster positives that we see.
Right.
And again, if you see 15 or so in one day, and if there's no connection that's obvious, then that's 15 potential clusters, and that's where that the alarm really sounds up and sounds off, and we have to do something different at that point. And so, but again, the reassuring part is that at the same time that we see these uptick in positives, that we don't see an uptick in hospitalization. And so when you see that together, then that means the system is working. That means we're catching cases early. I mean, we're catching them in a situation that's not more harmful, where these positives probably would have just become undetected for a long time until we started seeing high hospitalizations. Right. And so because we're seeing that early, I think that this is a good sign that we're putting things into our measures in place to prevent it.
Doc, is one of the, factors in terms of moving us from PCOR, moving between PCOR levels, having a robust contact tracing, effort?
And, that's one.
And considering the fact that we had seen this spike of 16, do we really have enough contact tracers to do all of these investigations?
Yeah, as of right now, we do. I can definitely say with confidence that we do, and it's a fraction of and the cases that have to be contact tracing is only a fraction of what we had to deal with back in March and April. So I want to remind everyone of that. So our capacity to do adequate contact tracing is even more robust than it was back then. And so with the different personnel that have been included into part of the efforts overall, and there are different levels of contact tracing also, where there's the really high risk ones, the medium, and sort of the low people, and so the more experienced people, the more clinical savvy persons, they go toward the more higher risk contact tracing efforts, and so it's actually more sophisticated than it was back then, and even back then it was successful. Yeah. And so I think we should be comfortable with things as it is right now.
Doc, we had a comment here. Tell Dr. Cabrera that the home quarantine instructions state you can go get essential groceries or takeout. I questioned that, but was instructed to just inform public health whenever I left for takeout or grocery shopping for essential items.
Interesting. Okay. Yeah. So the thing that
kind of seems to fly in the face of what the home quarantine is supposed to be about.
Exactly, and that has to be the absolute last resort. Like you have no other option, because the intent is that everybody should have a means of somebody else helping them do that. And then this is where we have to come through for as an island, as to how do we help our friends, our families that need help, that who are in quarantine, and that we deliver them the essentials that they need, and that they don't come out. And so that has to be very, we have to take that very seriously. And I don't know how that's actually allowed. Again,
I'm going to ask Linda. Oh wait, no, I'm not.
Yeah, and so getting takeout, there's delivery. There's so many other alternate options to this, and so there's just no just no excuse. If Payless started to deliver, then maybe that's a whole different thing. So maybe they should look into that.
Right. No, you're right, because you see the people that are at the government facilities. I mean, we've got National Guard, we got people standing outside.
They can't go out on a grocery.
Yeah.
Exactly. All right, Doc. Well, thanks for that. Appreciate it.
No problem.
Anything else you wanted to get out? I know we're going into a holiday weekend.
Right.
Yeah.
Let me get in here real quick. We're KUAM FM, Agatnia, Guam. Good morning to our KUAM TV 11 viewers on KUAM TV 11. Good morning. It's the KUM News Takeover, Guam's favorite, containing COVID on the line. We have from the Physicians Advisory Group, Dr. Felix Cabrera, and he was just asked by our Sabrina Salas Matanani his thoughts on the upcoming 4th of July weekend and what we need to do to mitigate the risk of spreading COVID-19. Doc?
Well, yeah, thanks, Chris. And so what I'd like to say, first of all, is that, we have to, even before thinking about the weekend, and it's that to understand that your baseline healthcare needs are very, very important, and they actually are the parts that's going to ensure that we really avoid what we're really most afraid of, which is increased hospitalizations at GMH because of COVID-19. And, we can be fearful of the spread of the virus, but we have to be the most fearful of what it means to our infrastructure, our hospital infrastructure. So because of that, I really recommend people for 4th of July, use it as a time to get more healthy. Use it as a time to get more exercise, to eat better, and to follow the precautions that we've shared, which is washing your hands, still wearing your mask when you go outside, when you go into public, as best as you can, even when you're in the beaches and parks. But understanding that the highest risk is when you're indoors, and that you really should be wearing your mask if you're in indoor public space. And then don't forget about, again, washing your hands frequently. Carry a small bottle of hand sanitizer if you can, and do it frequently. And every time you touch a door, think of that as a reminder to sanitize your hands. And so I really recommend that everybody do that. Take care of your baseline health, because that's the most important part in terms of us getting through all this.
All right.
Thanks,
Thank you, Doc.
Okay, thank you.
Wash your hands. Hey, is there a press conference today?
Not that I know of yet.
Okay, all right.
We usually have our 8:30 meeting with the governor every morning, and so a lot of times those decisions are made during that time period.
Okay,
but I'm not foreseeing one.
The second question, or last question, are you resigning or retiring?
It's hard to resign when everything I've been doing is volunteer.
Volunteer or voluntold?
A little bit of both. Yeah.
All right.
Well, thank you so much for what you're doing, though.
Yeah. Appreciate it, Doc.
So we have a great team, and the team is a volunteer team with the Physician Advisory Group. Right, I want to make that clear as well. And so we everyone here has been working very hard, for Guam and for ourselves also, because we live on Guam and Guam's our home.
Amen.
We hear you.
All right. Wash your hands.
All right. Take care.
Okay.
I will.
Take care.
Yeah.
Okay. Bye-bye.
One of my friends just texted me, Uncle Carl should have his own press conference. More exciting. That would be great, huh?
Oh, man.
He should. He doesn't need to ask anybody. He's Carl Gutierrez. Yeah. Like, I don't even think he needs to ask anybody to solve the homeless problem. Just go do it, dude. Hey, what's that saying about asking permission and forgiveness? Pretty sure you're not going to have to ask for forgiveness if you solve the homeless problem. Might get you a medal. It's 8:08. We're going to do news, and then we've got Public Health, Tess Archangel, to kind of talk about some of the numbers coming out from Public Health in terms of assistance. And Major Anton Uggan will go behind bars where they have had 2 COVID-19 positive cases with the officers at DOC. So we'll talk about that coming up right here on the KUAM News Takeover, Guam's favorite. It's containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Be healthy. Be informed with ITD.
Keeping you informed.
It's not always easy trying something new. Sometimes you have to help your loved ones along. Nana is so used to her weekly trips to the bank that going online can be a little scary for her. But her grandson knows that banking online is safer and easier. So he's teaching her how to get started using Bank of Guam's online banking videos. Teaching is one way to show our loved ones we care. Keep your family safe at home and show them how to bank online. Find easy-to-use online banking tutorials at bankofguam.com or on our Instagram and Facebook pages. Bank of Guam, member FDIC.
Ha'afare. When it comes to applying for unemployment benefits, as it relates to the Pandemic Unemployment Assistance and Federal Pandemic Unemployment Compensation programs, the first thing you'll need to do is create an account and register on HireGuam.com. Utilizing this button rather than the Not Registered button at the upper right login box will ease the pool registration process as it was built specifically for the pool program. The first page you'll see is the welcome page that explains the pool program and the 10 scenarios of eligibility that caused unemployment. Read through it entirely, and if any pertain to you, click Next. Input your social security number and then re-enter to confirm. Notice at the top of the page, the eligibility section is completed and the registration process begins. In order to complete your registration process, you will be asked to provide the following: a username and password and select a security question, an email address, or if you don't have one, you will be required to create one with the link provided, your residential and mailing address if different, your preferred notification method to receive benefit notices and updates, any prior military or current military service, education, occupation, your preferred payment method, such as direct deposit or paper check. Now, if you opt for direct deposit, you will need to supply your bank account and routing number.
What
Contraband yagitoru ilugar para honra para gloria abiba islasen para honra para gloria abiba islasen para todo y tempo y paz para ita tan gini langit na bendición contra y peligro na fan sa fuham tus protegis langwam contra y peligro na fan sa fuham tus
Move your body like a wave, and she ride me like a dream, and I kiss away her pain.
Oh yeah. Local music. That's the only type of music you'll hear on this show unless we're singing something, which we try not to do. That's Miss Roxy, meant to be age 17. It's containing COVID. The KUAM News takeover of Guam's favorite. There's so much going on. Always, right? Key dates. Tomorrow is the deadline to file for elected office.
You want to see who's running?
Yeah, we will. And I actually will get Miss Maria from the Guam Election Commission on to maybe touch base, because they're going to definitely have their hands full. Tomorrow it's 8:17. Again, the show is proudly brought to you by Ambrose, IT&E, Coast 360, Cabo Enterprises, and the Bank of Guam at 8:18. We just saw something in our chat, Bree, about this exception that we were talking about.
Yeah.
With Dr. Cabrera. You may leave the quarantine location for medical emergencies or to seek medical care. May leave the quarantine location to get takeout food or shop for groceries. Must remain in quarantine for 14 days from the date of arrival in Guam, but you can't have any visitors at the quarantine location. That's kind of not really sitting well with me. I mean, if the whole idea is that we keep people at home to avoid the spread of COVID-19 because we don't know if they're positive or not, why are we allowing them to go out? I mean, I get it though, right? If you don't have anyone to go get your groceries, you could starve to death. I'm not sure if that's ever happened on Guam though, but yeah, so that is the role. In case you guys are seeing people out there, maybe people who just arrived, I guess they're okay. But I'll tell you what, Dr. Cabrera ain't so cool with it. That's for sure. He was like, no, you have to stay home. So a little bit of, and I just WhatsApped him and he sent me what's that emoji where you
face palm?
Yeah, face palm. So, I mean, he literally did a audio face palm. About 20 minutes ago on the show when we had asked him that.
And you know what? If this is a gray area,
right?
Obviously the doctor as a physician would object to that and everything. But if it is in any way a gray area, even more reason why everybody needs to mask up constantly.
Right. Yeah. 8:20. Hey, let's do a day's dive into the. Let me just start that over. Let's do a dive into the day's COVID-19 headlines with the very latest. From the KUAM news team. Good morning, Sabrina Salas-Mantanani.
Holiday and good morning, everyone. The number of confirmed COVID-19 cases stands at 248 with 5 deaths, 179 recoveries, and 64 active cases. On Saturday and Sunday, Public Health's lab ran 486 tests, and again, 0 turned up positive. It's not clear whether a case reported by GPD was included in the total count over the weekend. GPD issued a press release Sunday stating that a police officer assigned to the Dededo Precinct Command has tested positive for COVID-19. The officer was identified through contact tracing, which means that he is connected to a confirmed case. The police officer is currently in home isolation. The Guam Police Department is working with public health to determine who may have had close contact with the officer. The Dededo Precinct Command remains open to the community. According to police spokesperson Paul Tapao, the precinct will still respond to calls and entertain complaints. As we reported, 2 Department of Corrections officers have tested positive for COVID-19. One of the officers, KUAM has learned, is a female assigned to the women's unit in Mangilao. DOC Major Anton Uggan says 20 female inmates are housed in this particular unit. At this time, other personnel and inmates have not been tested as a result of this second DOC confirmed case. The governor, in the meantime, on Saturday held a press conference making several announcements. Here's more.
Good day, everybody. Sabrina Salas-Matanani with the latest. Governor Lulian Guerrero held a press conference Saturday afternoon saying it was alarming that we have seen a spike in cases in recent days, but the increase was expected because we have increased our testing capacity. For now, all plans to loosen restrictions and further open up Guam have been shelved. Additionally, public health has seen an increase in cases in northern Guam and plans to hold more outreach in the area over the next several weeks.
Concerning thing for me here, and I think public health is too, is the 16 isn't clusters. It didn't come from clusters. It's now telling us that these are all over the community. And so that's why it's very crucial that we continue with our testing and we continue with our contract tracing. And that is why I put a delay and a hold on what other restrictions we were planning to lift. And so we're not going to reverse any of the restrictions we have made. We are continuing with the activities because we want to make sure the activities going on so we'll know what exactly is happening out there in the community. So that's why Dr. Cabrera is really tracking mobility, because as people are more mobile and we see that we're getting more positives, then we're thinking, hey, they're mobile, but maybe they're not wearing their masks. And maybe they're not social distancing. You know, these are the kinds of things that the complexity of it and the investigative questioning is what we need to be addressing, so we can really make sure we isolate and we prevent and protect. So this is the strategy. It's coming to fruition, like we said, and we are prepared and we have planned for this.
The governor also announced that no goal or date has been set to reopen the tourism industry. July 1st was the initial target date to reopen for tours from Taiwan, South Korea, and Japan. But again, the reopening has been postponed until further notice. One of the major announcements made during Saturday's press conference was another change in quarantine protocols scheduled to go into effect Wednesday, July 1st after midnight. All persons arriving to Guam will be still subject to a 14-day quarantine. For individuals who are traveling from a high-risk area previously referred to as a hotspot, a 72-hour pre-arrival PCR test is necessary to determine whether you will be quarantined at a government facility or home. And if you are on home quarantine, you would be eligible to test out after 7 days.
If you do have that test and it ends up becoming negative, then you have the early quarantine release, but you still must fully comply with the 14-day symptom monitoring and tracking. So that is key. So just because you get out on day 7 doesn't mean you're done completely. You still have to comply with this program.
As for an update on a hardened shelter for the island's homeless population, the governor said nothing was awarded yet. She said the biggest challenge has been finding a hardened structure to meet the guidelines and requirements for a homeless shelter. Meanwhile, today was the first press conference for Acting Director of Public Health, Lori Duenas, who takes over the agency after the announcement of the retirement of Linda and Pinko Denorsi after more than 3 decades at the agency. Media questioned the recent resignation and movement of several of her key cabinet members and whether there was word of a federal investigation. The governor said there was absolutely no truth to that. When asked about the loss of institutional knowledge of key cabinet members such as Denorsi, this was her response.
I'm not concerned that I'm losing institutional knowledge. Lori, for example, has more institutional knowledge than Linda. Lori started at public health way before Linda. In fact, Linda worked under Lori. So in the area of public health, I am very confident that the people that are there have the knowledge, the institutional knowledge, the scientific knowledge, the social knowledge, the investigative knowledge, the contact tracing knowledge. These people have worked with other diseases like tuberculosis, dengue fever. And so far, we've been kept pretty healthy. And the same way with our coronavirus. I attribute our containment to coronavirus because of the expertise of our public health. And so, as far as institutional knowledge, there are people within those agencies that have more institutional knowledge than the people that have decided to retire.
Today, meanwhile, will be the first day on the job for the governor's new legal counsel, Leslie Travis. As reported, Hai Hyun resigned Friday. Additionally, Airport Deputy Executive Manager John Kanata was approved by the board as the new executive manager. Kanata is a former senator, a former Guam Customs Director, and an officer with the Guam National Guard. He replaces Tom Atta, another former senator who abruptly resigned last week. The board also approved the hiring of Dr. Ricky Hernandez as the new deputy director. Hernandez is the current deputy administrator of the Guam Economic Development Authority. He also previously served as the director of the Office of Finance and Budget at the legislature. Expanded community testing continues this week. Drive-through testing is scheduled at the Mangilao Senior Center and Night Market area near the Santa Teresita Church. The testing is from 9 a.m. to 12 noon tomorrow. Tomorrow is also the deadline to submit required documents for those of you who applied for the Programan Slepi Zuden Itautau program. It is also the deadline to file for candidacy if you plan on running for public office. At least 23 people have signed up to run for senator, 12 of them Democrats, 11 Republicans, and 2 people have officially filed to run for the Washington delegate position. The Department of Labor explains some common misunderstandings and PUA fraud. For example, to qualify for unemployment benefits, individuals must be able and available to work. The Guam Department of Labor reminds the public that pandemic unemployment assistance and federal pandemic unemployment compensation is not available to employees who refuse to go back to work or who quit in order to receive benefits. Director Dave Della Sola says under the Coronavirus Aid, Relief, and Economic Security Act, quitting work without good cause to get unemployment benefits is considered fraud. If an employer calls you back to work and you reject the offer in order to collect benefits, that's also fraud. To qualify for PUA, you must be out of work or unable to go back to work due to one of the COVID-19 related reasons listed under the Act. Quote, the department recently received reports of employees that collected their initial PUA payments who are not returning to work. Employees must understand if your employer fires you for not returning to work and you do not have an approved COVID-19 related reason, you are disqualified from receiving further PUA benefits from the date you were fired. Employers can report firing an employee to pua.fraud@dol.guam.gov. An immediate hold will then be placed on the employee's PUA claim. Governor Lulian Guerrero signing several bills into law, including the highly debated Bill 366, restoring GovGuam employees' choice for a healthcare provider. The governor in her message wrote that she signed it into law, quote, because I believe healthcare is a human right, and essential to that right is the ability to choose one's own physician. The governor, in the meantime, let Senator Amanda Shelton's Bill 367, the Atsura y Mangafa bill, lapse into law, despite what she said included technical errors. As reported, the legislation suggests using the CARES Act funding for the program. The legislature cannot appropriate federal money. The governor in her message wrote, quote, it is because I value the overarching goal that I am willing to ignore the legislature's unintentional overreach into the congressional purse. The Supreme Court of Guam denies Mark Torrey Jr.'s petition for a writ to command the Superior Court to vacate its decision denying the dismissal of his case with prejudice. An amended indictment charged Torrey with aggravated assault and negligent homicide for the 2015 fatal shooting of fellow police officer Albert Piolo. Defense counsel Jay Areola argued his client's rights to a speedy trial were violated throughout the course of the government's second try of his case. According to the decision and order documents, the Supreme Court finds the lower court acted in good faith and the trial clock commenced on January 10th. Further finding, the defense's motion to dismiss told the speedy trial clock and resulted in the 95 days lapse between his arraignment and the beginning of trial. Cultural and environmental advocacy group Protehi Texan, or Save Ritidian, will host a virtual press conference today in response to the recent clearing of 3 cultural sites eligible for the National Register of Historic Places for the construction of a proposed marine base. Representatives from numerous community organizations will make short statements during the press conference responding to the destruction. Then a peaceful protest will be held at 3 p.m. on Friday at NCS outside the U.S. Naval Computer and Telecommunications Station to protest the clearing of cultural sites. All 3 sites cleared were eligible for the National Register of Historic Places under Criterion D. Under this criterion, sites show or may be likely to yield information important to history or prehistory. Yet, despite the significance of these sites to our history, they were dismantled and cleared for the marine base. For those attending the protest on Friday, you are urged to wear a mask and practice social distancing. In national news, the U.S. reported nearly 45,000 new coronavirus cases in a single day, the largest increase ever. Florida saw nearly 9,000 new cases, and 5 million residents in the Houston, Texas area are being asked to stay home as the state struggles with the resurgence of the virus. Daniel Bacchus reports from Los Angeles.
A level 1 red alert was issued Friday for the Houston area.
Today, right now, I am asking the community to stay home. Folks, let's be real. We will not get through this if we don't look at the reality of the situation.
Texas Governor Greg Abbott paused the state's reopening, shutting down bars again and scaling back restaurant capacity to 50%. This Houston establishment is urging diners to take precautions.
So if they don't come in with a mask, hey, here's a mask. This is the expectations.
Former CDC Director Dr. Tom Frieden says he thinks some states reopened too soon.
These are places that opened while they were still increasing. To open while you're increasing is kind of like leaning into a left hook. You're going to get hit.
Florida Governor Ron DeSantis reversed course on his state's reopening, effectively shutting down bars.
People want to be social. They want to interact, and that's why you're seeing it so much with the younger folks who, quite frankly, are at much less risk.
Florida and dozens of other states have reported a jump in cases from just 2 weeks ago. Delaware, Maine, and New Mexico are among others that are scaling back reopenings. No county in the U.S. has more COVID-19 cases now than Los Angeles. Richard Garay says he and about 30 members of his extended family caught the virus. His father died from it.
Our parents should die of old age. They shouldn't have to succumb to coronavirus.
The European Union says it will now ban most Americans from traveling to EU countries because of the dramatic increase in cases here in the U.S. Danya Bacchus, CBS News, Los Angeles.
Miami-Dade County's mayor will sign an executive order closing all county beaches for the July 4th holiday weekend through July 7th and possibly beyond. The order will also restrict gatherings of more than 50 people. In your Banking 671 report, don't be intimidated by pressure, threats, or confusion tactics of scammers who use scare tactics and coerce victims into acting quickly before they can look deeper into their lies. Never respond to threats and or demands for payment of your personal information. Learn about how legitimate businesses or government agencies might contact you by visiting their website or calling a number that you know to be genuine. That is your Banking 671 report, brought to you by the Bank of Guam and Coast 360. And that is your news.
Thank you so much, Sabrina Salas-Mantonati.
You're welcome. Welcome, Christopher.
8:34. The deadline to file is tomorrow, the Guam Election Commission. So we wanted to bring on Miss Maria from the GEC. Good morning, Miss Maria.
Half a day, Christopher Barnett.
We got Sabrina here as well, Miss Maria.
Half a day, Sabrina Salas-Mantonati.
Half a day.
So I know you're heading into the office. It's going to be a crazy 48 hours for you guys. How ready are you for this, Miss Maria?
Well, the staff worked over the weekend to take care of the ones that have filed so we can hurry up and get everybody ready for Friday. Friday is the set date for ratification of the candidates. So we're still, we looked through the candidate files thoroughly, and then we'll do it again before Friday to make sure that everything is in order.
Mm-hmm. The last one I see here that's updated, particularly for the senatorial race, it's 23. Is that still the number of people that have filed?
Yes, so
Okay.
Senator Luis Muñoz, I believe, was the last one to file on Friday.
Okay.
Did
Yes.
she sing for you guys?
I'm sorry?
Did she sing for you guys? No?
Chris, we are taking seeing the candidates downstairs, and I'm upstairs most of the time, so
Right.
we'll have to ask the staff from downstairs if she sang.
I think if she gets reelected, they need to make her sing every session because her output hasn't really been up there for me. So got to make up for it somehow.
That's for you to decide.
I know. That's why I'm happy to be a voter. So excited for this election, Miss Maria. I am a loaded gun. And I'm going to go in there and I'm going to pew, 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 pew. Actually, I think what's more important is I'm not going to pew, pew, pew for you, for some of you. Miss Maria, what about these candidates coming to file? Are they showing up? Because I've seen a couple of videos. Looks like they're showing up with big crowds. How do you guys kind of mitigate that with all the measures that are in place because of the COVID?
Oh, so we have the little space downstairs so that they don't have to come up to in a crowded elevator. And downstairs, we limit the candidates to one other person. The candidate and one can enter our office downstairs, and we can accommodate up to 2 candidates at a time.
Yeah, but there's still people like congregating,
Oh, outside, nothing we can do about that,
Right.
And when I'm outside talking with them, we practice social distancing. We also do the temperature scan, and we ask them the questions, and we lead them, or we make sure that they sanitize their hands before entering.
What about the people that have picked up packets? I know you guys keep track of that. Have a majority of the, let's just stick with senatorial because this is too much for the mayoral. Have a majority of the individuals that picked up packets filed?
We were doing a summary on Saturday, and there's only a few, I think, that have not filed that we anticipate filing in the next 2 days.
Wow.
So I think most of them have filed. We can't, we'll take a look at it and see if we can get you information on that.
Yeah. Oh, no, I'm looking at it. There's only like 12 Democratic senatorial candidates that have filed and 11 Republicans.
Yes. So, that's, so then it looks like almost everybody in the senatorial race will proceed to the general.
Mm-hmm.
So is that what you're hearing, Miss Maria, that they're only going to have 15 each?
I don't hear that stuff, Chris, but from what we're seeing, but we never know.
That's no
during
fun.
this time, yeah, we won't know. We won't know until 5 o'clock tomorrow.
Please, more of you guys file because I'm excited for some of you to lose. And if it's just 15-15, nobody's going to lose.
And you just move to the general.
Right, yeah.
Chris, we want good, excellent candidates because that's what attracts our voters.
Mm-hmm.
Right.
All right. But what about, let's move into staffing. Are you guys still in need of, I guess, precinct officials?
Yes, we are. We are still in dire need of precinct officials. Anybody interested, please visit our website. On the second row of tabs, way at the end, there's a tab for precinct official. Download the application form, complete and sign it, and just email it back to us with a copy of your ID. That'd be great.
Right, and we know that people are looking for jobs, but there's also the concern about exposure and the risk you're going to be taking to be working any of these polling sites. And so what assurances can the Guam Election Commission provide to these individuals that might want to avail themselves of being a poll worker or precinct official to ensure that they're protected?
We will equip them with PPEs. We will have face shields, masks. We will have hand sanitizers at their disposal and gloves. And we will practice social distancing, and we will have people taking voters' temperatures outside. you know, and we will continue to heed the advice of public health that we actively seek all the time to see if there are updates. We visit the CDC website to make sure that we picked up the best practices, and that's what we can do at this point in time. We will pick up additional help with our COVID funding to help the precinct officials with curbside voting as well.
Miss
Okay. Okay.
Ms. Maria, were there any takeaways from the Jotnia special election that maybe you learned from or you'll carry into the primary?
Yes, possibly making sure, and you know, the staff and I are still discussing it, making sure that the polling rooms are closer to curbside voting, where curbside voting takes place. Also, we're still in discussion as to whether we leave them in the cafeteria or the gym, or we put them in we put them in rooms. We separate them. We separate the precincts that are in one big room. Again, it's all dependent on what's available in terms of sometimes we have to compromise. If the additional rooms are further away than where curbside voting takes place, then it may, you know, in the end be better to leave them in the cafeteria or gym. Go ahead, Chris.
Ms. Maria, I was just going to ask about because I was at the last ballot placement drawing. How are we going to do all that stuff? Because that's usually you get the big room and you got all the candidates there and it's a big crowd.
Mm-hmm. We will do that. We will do it in sections. We talked about that on Saturday. It depends on what our list looks like by end of day tomorrow, and we will take care of them in sections. And please note that on Friday, July 3rd, which is a holiday, the board will meet at 12 noon. And then after the ratification and after the business of the meeting, we will start to call in for ballot placement drawing.
Same day?
We will do it in sections.
Same day? Is that what you said?
Same day, yes, ma'am.
Okay. You guys don't have the ability to do Zoom or Facebook Live, anything like that?
Yes, we do have that capacity, but you know, based on how meetings are done, our board meeting must notify the public at the last board meeting or at the previous board meeting that they were going to do it through Zoom or electronically. The board, we are going to do a in-person meeting on Friday, and from there, you know, the ballot placement drawing does not need to take place inside a meeting. So those we will notify candidates as we finalize the plans for ballot placement drawing. Thank you, Sabrina.
Ms. Maria, are you guys able to monitor? Because we have a lot of new candidates. Maybe they don't have the best understanding of the rules and the laws. Given everything that you guys are juggling in terms of having to conduct this election and everything with the COVID-19 hanging over our heads, is the Guam Election Commission still able to adequately monitor candidates, you know, campaign stuff and the signs and all that stuff you guys normally keep an eye on?
Yes, Chris, with regard to that, our voter registration, as you know, is ongoing. So that takes a lot of manpower. We also, as far as campaign finance goes, the big reports are due 10 days before the primary. So with regard to that, candidates, when they come into file, most of them have already filed their organizational reports. If those were filed earlier, those reports were looked at. We already looked at those. So all we're doing now is going through the candidate packets, the ones that were turned in, and making sure that everything is in order. And that's that's the latest and the greatest at the GEC now.
All right. Well, thank you for the latest and the greatest. That's all we want, Miss Maria. Only the greatest.
It's like I said. I think I was the only one that left before dark on Friday. We're already in the election mode. The staff, I think, are leaving like late, 9:30, sometimes 10, 11 o'clock, as we continue to make sure that Guam still has honest and fair elections.
Miss Maria, you guys saw a big turnout for the Jotnia special election. Are you anticipating the same kind of numbers for the primary?
You do. Again, the voter participation is driven by the slate of candidates. So where there is contest, where there are challengers to the incumbents, that's where we will see the higher voter turnout. Based on the historical data. We also, we're also watching the federal election to see for the congressional delegate to see if that will bring out the young and more voters overall. So we'll see.
I noticed that Congressman Michael San Nicolas, he did file to run. Did he? So you don't need to file in person.
We stress, yes, that's correct. We stress that all the documents must be in order. All the documents must be signed and initialed. The clearances must be less than 30 days old, and if there are notaries needed on the documents, we make sure that those documents were duly notarized. So yes, if the packet is complete, we will accept it, and that's how Congressman San Nicolas's packet was accepted. Not by him, but one of his staffers brought it in to us.
I wonder if he didn't come back because he doesn't want to get thrown in quarantine jail. I mean, no, I know you don't know, but that's just what I was thinking because he hasn't been back in a while. Okay, so Ms. Maria, you want to recognize your staff? I know that we had talked a little bit, and they're working really hard. So, do you want to maybe pat them on the back a little bit?
I will. They've been actually, when I was at the public hearing for our budget last week, they were asking me about something happened, something came up with retirement. I said, yes, I can possibly retire, but none of my staff I've asked all the time who's interested in becoming the director, and none of them are at this time, so I have to wait. But, in the...
Wait, are you resigning or retiring, Miss Maria?
No, not yet.
Not yet? Like when? Not yet now, or are we going to get a surprise next week?
No. I really believe in succession planning, and I believe that's how we should do it. But one of the things that came out last week was that in going through the cost of the Guam Election Commission, if we keep the staff together, at this point in time, we have a total of 107 years of experience in elections.
Wow.
And that's only 14 of us.
Oh.
2 of us have over 15 years of experience in elections.
Let me ask you something else that came out in the budget hearing. You said you want your budget to come from DOA, not BBMR. Correct?
Yes, that's correct.
Okay, and we also had saw that BBMR delays the Election Commission payment in court cases rule in favor of DOA, not BBMR, overseeing the Guam Election Commission budget. Please, can you give us a little more info on your concerns and why you want this change?
Overall, we want to ensure and commit to the independence and the autonomy of the Election Commission. And that's because on both sides, the governor is elected and the legislature is elected, and the foresight of the legislatures before us said that all expenses of the election commission are to be paid by the legislature, and it's paid by the legislature through the submission of a detailed budget to the legislature. So we made it clear to the legislature and to the island that the way it is done at the commission, the board is the final approving authority. We prepare the budget, the staff and I prepare the budget, we bring it to the board. And the board either approves it or asks us to change it or asks us to include something else. We bring it back to the board. They are the final approving authority. And we still follow the constraints of the executive branch processes where we submit it directly to the legislature on January 31st as required. Because of cash shortages and because of the overall condition of the economy of the government of Guam, we are sometimes hampered by those challenges. And I think, in past elections, one of the things we see is that the precinct officials are not paid on time.
Right. Is that because of BBMR?
Possibly, right. Or possibly because of this cash shortage. Right. But, how can we have a good fair election if we don't have good precinct officials? And
Ms. Maria, is there an issue with you guys in BBMR? Because in doing my FOIAs, I always FOIA for any raises or pay increases through BBMR, and I saw that you guys had some that were just like in limbo over there, while other raises were continuously being approved. BBMR continued to hold you guys. I mean, I don't know if hold your pay increases hostage is the wrong characterization of it, but has it been a problem for you guys to get money out of BBMR in a timely manner?
Well, since November 2018, after I think it was November, I'm not sure now, but because it's been some time, there was a public law that was passed that funded the reappointments. We're all unclassified, so we don't get increments, we get pay adjustments, right. And we don't get reclassified, we get reappointed. So it's already been 2 fiscal years, I believe, where we've gotten an appropriation from the legislature that to fund the reappointments of the staff. And so that hasn't come to be because based on what BBMR tells us, because of the cash shortages.
Right.
The reappointments were approved back in, I believe, fiscal year 2018 maybe or 19, and again reapproved for fiscal year 2020.
No, and I've seen it, and I've seen other people get raises for more money, but you guys haven't. So I'm just thinking there's got to be something personal here going on with Lester Carlson and the Guam Election Commission. And I'm just going to say I seem to remember something about you guys, he didn't turn in his financial disclosure, or he was trying to wiggle out of it or something.
Well, Chris, that's something that's something that's been discussed on the backside. But what I need to say is that officially, when we turned in our budget for fiscal year 2020, the appropriation that came back was not what we asked for. Hence, when we turned in our GG1s, October 1st, 2019, we were told that they cannot be processed because we don't have enough cash. Well, in the allotment schedule that I submitted, I made sure that the personnel categories were sufficient. I requested that enough monies be allotted to personnel so I can execute. So those GG1s can be, can be processed. But in the end, they were not.
So,
and that's that's what happens, and we're not there yet. And
right.
Again, I brought it up in the public hearing last Friday.
I saw it. So, Miss Maria, ever since you guys, and refresh my memory, but I seem to remember something about you guys forwarding Lester Carlson's name to the AG's office, or am I accurate to say that? Because he didn't file his disclosure or something?
Yes, it was. There was back in when he was acting director of BBMR. He was he believed that he did not have to file personal financial disclosure,
right.
But we brought it to his attention that just so long as he's in acting capacity, as of April 22nd of that year, that he is required to submit a personal financial disclosure.
And so since then, since you guys afforded his name, have you guys been able to get anything out of BBMR?
Well, I have to say that our overtime plan for this election cycle was approved as of last week.
Oh, okay. So we're good except for the pay adjustments.
Yes, and I pray that that happens. I think the candidates can attest to the staff, and people come up to me and say, "Oh, you're doing a great job." I always have to say, it's not me. It's the 13 of them that make me look good.
All right, Miss Maria.
Again, yes, thank you.
Thank you.
Thanks,
wash your
Maria.
hands, Kay.
I will.
Okay.
Thank you, Sabrina.
All right, take care.
Okay, Steph. There you go, 8:57. Bree's going to read off the candidates. And these are just the senatorial, Bree?
Well, we have mayoral, and we do have senatorial and congressional. So I'll just go ahead and read them all.
Okay.
For the race for Hagåtña mayoral race, we have John Cruz and Anthony Lujan. Both are Republicans. John Cruz is the incumbent. In Arahan, we have Anthony Charkaloff Jr., Democrat. Kenneth Mantanotña, Democrat. In Barrigada, so far, we have June
That's going to be
Blas.
a hot race.
The one in
The Iran
Iran
one, yeah, it's a very heated.
Okay. In Barrigada, we have incumbent June Blas, Democrat, right now unopposed within her own party, but Jose Menglonia is running on the Republican ticket in Chigo. This is a big race for mayor there. Lillian Guerrero, Democrat.
I'll just start by saying Mayor Rudy is not running for re-election.
Right, he's not running. Okay. So on the Democrat side, we have Lillian Guerrero, Francis Lizama, and Dennis Flores. On the Republican side for mayor, James Santos and Anthony Sanchez.
Anthony Sanchez is the current vice mayor.
Okay. And James Santos is a retired police officer.
Right.
Asin Maina, Frankie Salas, the incumbent so far. No one's running against him. In Talafofo, we have the incumbent Vicente Taitagui finding some competition with Albert Atoigui running on the Democrat side. In Barrigada, still Barrigada Vice Mayor Jesse Bautista. He is the incumbent Democrat. No one's running yet or has filed. For Chigo Vice Mayor, Republican candidate is Loretta Leonis, and the Democrat candidate is Edward Lujan. In the village of PD, so far, Jesse Alec, the incumbent Republican, is running unopposed. In Jotnya, Edward Terlahi right now is the lone Democrat candidate, but we did hear from the current mayor who just won in the special election that he plans on filing. In Mingilao, right now, Alan Angata, the incumbent Republican, is unopposed. But again, everyone, the deadline is tomorrow. In the village of Agate, Kevin Siswico, the incumbent Republican, is running unopposed within his party, but Mary Ann Charfris, Democrat, is running for mayor. In Orat Chalan Pago, Jesse Gogui, Democrat, running unopposed right now. Mangilaw Vice Mayor, we have Republican Thomas Duenas, and on the Democrat side, Kevin Delgado. In the village of Agate for vice mayor, we have Democrat Jocelyn Regis and Republican incumbent Christopher Farron. In the village of Sinahanya, unopposed, a Democrat, Mayor Robert Huffman. In Tamuning, also unopposed right now, is Republican Luis Rivera for mayor. Santa Rita, Dale Alvarez, Democrat incumbent, running opposed within his party right now, but he could face off in the general election against Kelly Lizama. In the village of Sinahanya, unopposed right now for Vice Mayor Rudy Iriarte, Democrat. Tamuning Vice Mayor, we have 2 Republicans running, Albert Tovis and J.D. Ritalig. I know he's ran for senator a few times.
Right.
In the village of Umatic, Johnny Canetta is the incumbent. Republican, unopposed right now within his party, but there are 2 Democrats seeking to take over, Gilbert Uggan and Andy Santiago. In Agania Heights, Republican Paul McDonald, who is the incumbent, running unopposed within his party as of today. But on the Democrat side, we have Jesse Pangilinan and Jesse Fujikawa, who are seeking the position as mayor in Agania Heights. In the village of Dededo right now, Melissa Savaras is unopposed within her party, but Jose A. San Augustine, Republican.
This is the guy who used to run the prison under Governor Eddie Calvo.
All right, and he is running
Republican. But I want to say that there's a lot of Jose San Augustines, but I know he's a Jose A.
Okay, well,
right.
It's there.
Okay.
Maritzo Mayor, 2 Democrats are running, Julie S.N. Cruz and John Tyron. The incumbent Republican Ernest Charkaloff. No one else within his party has filed yet. In Mongmong Totumaiti, Rudy Paco, incumbent Democrat right now, unopposed. And Dededo Vice Mayor Vincent Cabrera, Republican. And Peter John Beneventi, Democrat. That is the Vice Mayor. Moving on to the senatorial race. These are the individuals that have filed to date. Tomorrow is the deadline to file for candidacy. We have filed incumbent Telo Taitagui.
I didn't know her middle name is Teresa.
You do now.
I do now.
Okay. Also Republican Ryan Calvo, Democrat Speaker Tina Munoz Barnes, who's an incumbent, as well as Amanda Shelton. Another newcomer here is Vicente Anthony Borja Ada,
a.k.a. Tony Ada.
Oh, okay, running Republican. James Moylan, incumbent, running Republican. Kelly Marsh Taitano. Vincent Borja, Republican. Joe San Augustine, incumbent. Therese Serlahi. Joseph I. Cruz, that's J.I. Cruz, former police chief, Republican. Joaquin Leon Guerrero, Republican. Clint Rigel, Democrat. Dave Duenas, Democrat. Sandra Regis Sayal, Republican. John Albert Ananich II, Democrat. Dominic Joaquin Hernandez, Republican. Jose Terlahi, Democrat. Mary Torres, Republican. Fred Berdalio Jr., is another former police officer. Also, did he run for lieutenant?
Yeah, he ran for lieutenant governor with Uncle Carl.
Yeah, okay, Democrat. Franklin Meno, Democrat. Frank G. Leon Guerrero, Democrat. He should sound familiar. He is the former U.S. Marshal for Guam, and he also was over at the Superior Court. It was in charge of the marshals there. And then we have finally Luis Munoz, Republican incumbent, and that's 23 candidates so far that have filed in the senatorial election. As for the congressional race, filed to date is Senator Will Castro and Congressman Michael San Nicolas.
But obviously, we've heard so much buzz about former Delegate Robert Underwood running. I'm pretty sure that's a done deal. All that remains is for him to file, which obviously will probably be this week.
Yeah, and then again, tomorrow is the official deadline to file for candidacy. So it's going to be quite a busy day for the Guam Election Commission, I would assume, today and tomorrow.
I'm kind of disappointed. Maria Pangilinan said we need good candidates for people to come out and vote. But I think having bad candidates will also make people come out and vote. And I really got to tell you guys, there are a lot of puppet candidates. And I call them puppet candidates because it's obvious that they're being manipulated. They're being put out there by people who have an interest in getting a real live senator to just do their beck and call in the Guam legislature. And so what I think is going to happen with this COVID-19 election is we got to register and go out and vote, because I feel like it's going to be very easy for some of these puppet candidates to manipulate the system and get elected if we don't go out and vote smart. So I'm taking this serious. Like I said, I feel like a loaded gun. I don't know if I'm necessarily interested in voting for anyone. I've always been kind of a vote against. Like, I swear, they should change it where like you can vote one vote for somebody or 2 votes against somebody. Like, if that was the way it was, like, all my votes would just be against somebody, because I'm just motivated to go in there and like keep people from winning. And you could do that by bullet voting is one way. You just vote for one candidate, which, I mean, it's hard.
Yeah, not that. I just thought there would be more.
I thought there'd be
names.
more. And I
Yeah.
heard, I'd heard some people's names being tossed around. One of the names that we were talking about last week was Sarah Phyllis Camacho. And so I'd asked her, I said, "Are you going to run?" Because she asked me, "Are you going to run?" And I was like, "Well, are you going to run?" No, are you? No, are you? And she said, when she's ready. So I don't know. I don't think that means this election, but it's really interesting to hear some of the names that people are throwing out. And it's also interesting to see some of the names that have already been thrown out. Is it going to be
It'd be interesting if she ran, though, I think.
Well, I think this is the
pretty-
election. Like, if you're kind of thinking about you maybe want to run, and you were thinking maybe in the near future, I think this is an election where some really good people can get in and some really bad people can get in. So the more pretty good people we have that run, the chances of the really bad ones getting in, I think, are lower. So that was my plea to you guys. Please go out and vote. Don't let these puppets win here. Okay, it's 9:06. Let's go behind bars now, where definitely they have some news that we want to hear about. Major Anton Uggan. Good morning, Major.
Good morning. Good morning.
Good morning.
Wow.
Good morning.
So two DOC officers. I know that one of them was a female corrections officer working in the female unit over at DOC. What about the other officer?
There was only one correction officer that, as of last week, tested positive for COVID-19.
So there's not 2?
No, just one of our correction officers.
Oh, okay, so did an inmate or a pretrial detainee?
No.
No one
Not
else.
that I'm aware of. No.
Just one. Okay.
Yes.
And so where are we then with testing employees? Is that part of the plan, or testing any of the women in the unit or any of the inmates, no matter where they are at DOC?
Right now, what's going on is the public health is conducting their contact tracing. And so a lot of it will determine what's the result of their investigation on who would need to be tested. As of now, they just gave us a list of about 5 officers they need to see as a result of their contact tracing. But again, it's just preliminary. They just started. So will there be more officers? I don't know. If they need to see them or possibly test them, I don't know. It's just going to depend on what's the result of their investigation.
So just officers at this point, no inmates or detainees?
At this point, no. Again, as part of their investigation, if they determine that, possibly an inmate may have had, close contact, which may result in the transmission of COVID, then I'm pretty sure they would probably test that inmate. But as of now, where they're just looking at officers, and again, the investigation is just preliminary, so it just depends on which way their investigation goes.
Major, is there any connection with the DOC officer positive and the positive over at the Guam Police Department?
Not that I'm aware of. I've seen the one at GPD, but I cannot confirm and say if anything was related, because I don't know who of the GPD is positive.
Okay. All right. What about the women that are in the unit that were connected to the female officer? Have you had to move any of the inmates around or anything like that?
No.
Okay, so they're all in.
Yeah, they're all still there, and we did talk to the medical team this morning, and as of this morning, 8 o'clock, there have been no complaints or any issues from any of the prisoners.
Mm-hmm. Okay. Had this particular female officer, she worked or in any other units or signed to any other units other than the female correctional side?
Based on our report, yes, she's worked at the clinic, the infirmary. She was assigned there for a few hours, and then she was reassigned down to the female unit. She also worked in our RSAT building, and then she was again reassigned back down to the female. Most of her time is spent in the female unit.
So the 5 officers that were identified as close contact with this particular female officer, were they assigned to other units, any of the units that you just referred to, or are they just within the female unit?
Most of them, out of the 5, 4 of them are female officers that were working with the officer that tested positive. The other one is a male officer that was around her while she worked at the clinic.
Okay, so what about
our clinic here at inside the prison?
Mm-hmm. So what about the people that are the inmates that are in the clinic or anybody else inside the clinic? How have you guys done checks on them? Or are they not considered high risk exposure?
Well, the clinic is mostly with nurses. And so with the nurses, I believe with the GMH side, those nurses were tested as part of their protocol on GMH side.
And what were are you aware of the results?
No, ma'am, I'm not. I think that the test just happened Friday or so. So I don't know what the results are.
Oh, but they would let you guys know because they were in your facility, right?
Yes.
Okay. Yes. Okay. So what is if we could go over the plans for when a situation like this happens, what does the Department of Corrections do? We just kind of wait for public health to tell you guys this is what you need to do?
I mean, most of it with the staff, yes. An officer reports that, then we have our protocols. We contact public health. We work with them on the contact tracing to help determine who needs to be screened or who should be isolated. I mean, the first time this thing happened, we automatically, with the recruits, put all the recruits on administrative leave, self-quarantine, but we can't do that with all the other officers. I mean, just the absence of the 5 officers, it can impact our operations here. So, again, we do tell our officers if they are feeling any symptoms or sick, whether it's this COVID-19 symptoms or if they're just sick and they don't feel well, to go ahead and stay home and seek medical, check their, go to the doctor and get medical checkup.
For the female unit, how many officers are assigned to the female unit, and do they have to be female? Just because I'm wondering, you said there were 5, 4 of which were identified for testing, so they're on what, quarantine, right?
Yes.
Until they're tested.
The only female officers are assigned to the female unit.
Do you have enough female officers then to work this female unit while the 4 are they on quarantine?
Well, right now they're still meeting with public health. The other 5 officers, they will be meeting with public health later this morning. The person in charge of the contact tracing will be meeting with each of them, and whatever his protocol in regards to investigating this. But we do have other females. We may have to reassign some from other sections, like transport and other areas, to cover down.
Yeah.
But it's nothing that we have not done before, as far as reassigning personnel.
Right. I just didn't know if you had enough female officers, because I believe you said 4 of the officers that were identified were for testing or as close contacts were women. assigned to the women's
we
unit.
have enough FEMA officers. We just have to reassign them from other sections.
Right.
But some of them may be in our transport section, our visitation section, and other sections within the department. We just have to reassign if need be.
Major, it kind of sounds like you guys have a better handle on public health in terms of where this a positive officer was working, who she was in contact with. That being said, have you guys, while public health is doing their contact tracing, have you guys on your part done any measures to kind of compartmentalize, if you could, anybody who's coming in contact with her?
Well, yes. I mean, because we still have our own protocols in place as far as the mask wearing and the, so we still have all these other precautions that we implemented months ago that, we've been doing to prevent this. I mean, we kind of anticipated that something like this might happen eventually. And that's why our director are always stressing on the wearing of the mask, because even if you do come in contact with someone with COVID, if you're wearing your mask and protecting yourself, the chances of you catching it is slim. So,
just curious, DOC, do they get the differential pay?
Yes, we do.
Okay.
We get the extra pay.
Major, are you planning on resigning or retiring anytime soon?
No, I just hit my 26 years tomorrow. Wow. Tomorrow's my 26 years of DOC. So no, not yet. Got a few.
God, 26 years at DOC, that's like 56 years in any other agency.
Yeah, so no, not yet. Still going to be around.
How about Director Carbolito or Deputy Director Camacho? Are they planning on resigning or retiring?
Wait, Camacho. Is Camacho there?
Robert Camacho, yes.
He's still there? Did he retire? Or?
He retired from the airport police. He is here now, and no, I don't think any of them are planning on retiring or leaving soon.
We just got to ask because, there's something else going around that is more contagious than COVID.
Oh, boy.
Yeah. It's QuitVid. It's QuitVid.
No, we're still hanging in there. The other thing, too, I would want to let you know, Chris, that because of this, we were scheduled to have incoming for the inmates, I think by next week or so, but right now the director has suspended everything again until such time the public health is done with their contact tracing. So we're not going to have any incoming or anything like that we were originally going to have. And again, we just go back to square one for now until public health has, figured out who may have contacted it.
Major, what is the public health contact trace investigation? How many people are investigating this? Who are you in touch with? Because remember, one of the key parts is having a robust contact trace investigation team. And right now they're investigating 15 positives all over the island. Or 16. They're doing the airmen probably. They're doing a contact trace investigation at the prison. Yeah. So what type of numbers are you seeing from public health investigating this? Because we're just trying to find out by going all around if they're short or if it's an adequate team.
Well, I don't know what team they have in place. I do have a contact. They contacted me over the weekend, the one person that I'm dealing with. So I'm just going through this one person. Now, if he has a team on his side, I'm not aware of it. I don't know what team he has in place. To prevent any kind of mix-up of information, I'm just dealing with one person right now. And so, I just refer my officers to this guy and this gentleman, and he will take care of the rest, and he lets me know if he needs something else, and then I just get what he needs or who he needs.
Yeah. Okay.
Yeah.
What about Contraband? Update, Contraband, Inmate smoking ice. Where are we with that?
Well, we haven't really had much Contraband over the weekend or the last week, so not to say that we won't have any this week, but pretty slow week last week.
Is there any talks at all about the possibility of getting all the officers tested or all of the inmates, detainees tested?
That has been brought up numerous times, and again, with the inmates, a lot of it probably has to do with maybe the resources, because we have 630 some inmates.
Mm-hmm.
In addition, again, you would need to test all the officers too. So, working on a plan for that, that would be pretty intensive as far as how do you test inmates and officers simultaneously. And then we would look at isolating, because I believe when you test them, you have to separate them from the ones that are not being tested. And so, again, it's not impossible, but it is a pretty big undertaking.
Wow.
So right now, again, we just take our guidance from public health as far as who needs to be tested.
And so basically, you guys are not testing all of the officers because there's a concern that you can end up with a bunch of positives, and then who's going to watch the prison?
Well, even if they're negative, Chris, I believe when you test them, they have to be isolated for so many hours until the test, or a day or two. So if I have 200 officers and I decide to test all of them, who runs the prison?
Right. But on the flip side of that, Major, if you don't test them, they could all be COVID positive, and we don't know, and they spread it.
I mean, both ways. It's it's not a perfect situation, I guess.
How about you? Have you been tested?
No. I'm not feeling any signs or symptoms, and there's no need for me to be tested right now. But I maintain my mask and do what I'm required to do to try to protect myself. Right. It doesn't mean I won't catch it in the future, but
of course,
I do what I can to protect myself and my family. But right now there's no need for me to get a test.
Okay. I think we're good. Anything else you want to add, Major? Are we missing anything?
No, not that I'm. No, pretty much.
They always say that. I never had one government of Guam person say, "Yeah, you're actually missing the thing, the real controversial thing you didn't ask me about." He's like, "Nope, yep, we're good. I gotta go."
We're good. Yeah.
I did want to go back to the first DOC officer. Was there any finality in determining where that officer may have contracted COVID? Was it?
No, my understanding when it first happened was it was from a family member.
Okay.
Right.
Okay.
Yeah, it was a
young. Got it from a family member, but
and so
then he has returned back to work and no other issues.
What about the current one? You guys, it's too early to tell whether or not.
Too early. We don't know.
Have there been any new women that have been brought into that particular unit where she's assigned?
You know what? We don't get a lot of women every day, but cause right now the population there, I believe, is about 20. I don't know if maybe one or two new consignees came in since last week, but I'm not really sure. I don't have the numbers in front of me as far as the daily confinement.
Okay. Yeah, it just would be interesting to see if there have been any new inmates or detainees. Is it just all pretrial detainees or just inmates in that unit?
No, we only have one female unit, so this female unit does have inmates and pretrial detainees.
So, okay, so it's a mix. All right.
Yeah. One of the things we're hoping, is because of our procedures in regards to the wearing of the mask and stuff, that, even if our officer did have it or a prisoner had it, no confinee, that the risk of being spread to the other staff or other will be minimized, because even the inmates they do have masks. So the inmates have masks and officers have masks. So, that's one of our preventive measures, that in the event someone does have it, it may not be spread as easily if that officer or that inmate is wearing a mask.
But the inmates don't wear masks. They do?
All the inmates do have masks.
Right. Okay.
Was that from the director, Major?
We gave that out, we gave them out several weeks ago.
I remember, yeah.
Yeah, we've been giving out masks to the inmates.
But I remember you said that the director had a bottom. Was that just with his personal, or is this department funds?
Department funds? Yes.
Yeah. Okay.
Are these disposable masks or are they reusable?
Most of them are disposable.
And so how often are the inmates and detainees given a new mask?
I have to speak to my supply on how. I mean, I know each unit has masks, and if the inmate needs one or needs to replace it, they can go to the officer and they can replace it.
Okay.
I don't think they're given a new one every day or every week. It's just once it's been issued, if they need a new one, then they can get a new one.
So one and done unless they need a new one.
Yeah.
All right, but again, there's no movement to test all the women in that particular unit because of the fact that you're mixing pretrial detainees in the in that unit, which means that
they're leaving the prison.
Right.
Yeah. Not at this time, but again, if public health determines on their contact tracing they need to, or any of the females start to show symptoms of COVID-19, then of course that will dictate how the medical staff respond.
Mm-hmm. Yeah. Okay. Well, yeah, it'd be interesting to see I guess the SID report today to see if this female officer had any connection to a confirmed case, and if not,
I mean, the officers do. Of course, we interact with inmates, but most of the time the officers are not like in direct.
They're not French kissing the inmates or
face.
Yeah.
They're not necessarily standing right at the inmate's face.
Right.
I mean, most inmates, if you're just in your cell or in your area, you'll see an officer, but it's not like you may or may not come in direct contact with that officer.
Right.
They don't go up to the face of every inmate and see them, and our officers too are practicing. They don't need to get up in front of the inmate. They can give instructions from a distance when they give instructions on doing things.
Right.
Okay, Major.
Thanks, Anton.
Okay.
Be safe.
Okay, you too.
Keep us posted if you can. Shoot us a message about any developments.
Okay, I will just have to wait for public health to give us what they discovered.
I'll call Linda too. Oh wait.
Okay.
No, I won't. Yeah.
No, you won't.
Okay. Can't call Linda. Okay, Major. Thank you.
Thank you.
Right. Wash your hands. 9:27. Let's keep it on the phones here and bring on Maria Hernandez of Pertay La Texan as they've got not just a protest, I think, scheduled for Friday, but also a press conference today. Good morning, Maria.
Hi, buenas tardes. Maasi for having me on to talk about the protest this Friday.
Right. We'll just start with the issues at hand here. Is that you guys are saying that during the COVID, the military buildup has rolled on.
Yes, yeah, we actually this current project, the PA memo came out. The PA memo is kind of what the military issues that outlines cultural and environmental impacts from various projects. So there was a PA memo that came out for a project at the Marine base, and that came out early this month. We kind of had to put puzzle pieces together to figure out exactly what happened with the site. We were reading the PA memo. We were looking at articles about the public comment period. And what we were seeing was that in the memo, it wasn't entirely clear that the site was dismantled and cleared. So, that was an issue for us, that we weren't able to, in reading these documents from the DOD and in reading articles from our own local media, that, the clearing had happened, but we had to kind of put the puzzle pieces together with articles, the memo, and looking back at what happened with Magua Village in 2018, that when the site was cleared in 2018, we were told that it was data recovered. So we had to have that understanding that data recovery had happened to come to the realization that the sites were cleared. So I think for us, like that, when we realized that 3 of these sites on NCS were eligible for the National Register of Historic Places, and they were cleared. This comment period comes after the sites were already cleared. So, it was just really, really troubling for us. We decided, okay, this is insane that we have 3 sites that were of this level of significance, that they're moving forward and they're clearing it after, and then having the comment period be after they are already cleared. So yeah, we decided let's do a protest this Friday. Let's raise awareness about what's happening because we really need to be sure that the community knows, because we are a group that kind of follows what's happening, and even we're confused. So,
right, yeah. So,
yeah,
Maria, let me ask you, like, it sounds like you guys had to play a little bit of Sherlock Holmes with this, but do you think that on our side, the local government should have done more to maybe give us a clue about what was going on? Or do you think this is something that just kind of slipped by everybody because of the COVID?
You know, that is something that we've thought about. We're in the middle of this pandemic, and, you know, we're all just struggling to stay healthy and make sure that our community is safe. So, you know, this is probably build-up projects are kind of, they're not on that main, you know, on the front page of the papers, and aren't necessarily, you know, on, you know, our local media channels for that reason. So, you know, it's disappointing because we have people in our government who are supposed to be tasked with informing the community, and you know, if it wasn't for our group kind of having to get together and piece all of these puzzle pieces together, we wouldn't have known that 3 sites eligible for the National Register of Historic Places were cleared. And I think when people think about clearing for the military base and for the firing range, they think, you know, 2 square feet of land with a pottery shard on it, you know, that's significant still, you know, but that's maybe what's in people's mind. But the largest site cleared was actually 12 football fields in size. And, you know, this is the level of clearing that we're seeing, you know, happen. We're not sure when exactly it happened because the PA memo came out after, you know, like I mentioned, came out after the clearing had already taken place. But we do plan after the meeting to request, after the protest, to request a meeting with SHPO Patrick Lujan to find out what exactly happened, because he does have the authority to at least put a pause to reevaluate, you know, a project, especially a project of this level of significance. So we want to find out, you know, what happened. Was, you know, was the ball dropped? Like, we want to know the details there.
So then why, Maria, are we protesting outside the military gates and not protesting at SHPO or at Adelup, since, as you just said, that, you know, our government officials should have known or may have known?
You know,
why aren't we seeing this? You guys have protested it with the military in the past, and it didn't really, you know, I don't see it having gone anywhere. And why aren't we putting the pressure on our government leaders?
You know, this is a question that we get a lot when we choose a protest location. You know, we always get the question, why not there? Why not there? And I guess, you know, we're choosing what most makes sense to us. But of course, there are going to be different perceptions from people in the community. So by all means, you know, we ask people in the community, it doesn't have to be an advocacy group that, you know, is always coordinating these protests. If you're fired up about it, please also show up, you know, to these different areas, show up to the governor's office, have you know, something in solidarity with us to show that this is not okay, and the erasure of our culture and our heritage sites are not okay.
Yeah, it's frustrating, Maria, because you know, obviously, it's not like the governor or the SHPO's driving the bulldozer and clearing everything, but it kind of seems to me like they're just standing by doing nothing. And so I feel, and I agree with Sabrina in that our local government is complicit in everything that's going on with this buildup for the most part, right? I mean, yeah, you have a couple senators who are making a lot of noise about it, but why are we looking past our local government, which is complicit, like I said? And I mean, are we? I guess, are we holding the governor and the SHPO accountable or not?
Yeah, I don't think we're looking past our own government. We, you know, we have met with SHPO Lujan in the past. That's something that we do plan to do after this protest. You know, we do realize that at this point it could be because of COVID, but our leaders, many of our leaders have just been silent in response to this. So I think the message that we need to put out there to the community is that as a people, we need to take back the power, because we have power as a community to affect change. We see in the States with, the Black Lives Matter protests, I think many people on Guam are seeing, wow, when these people come out and protest stateside, that we're seeing so much change happen. We're seeing so much legislation being signed, in protection of human rights. And, for that reason, we are having a lot of people actually respond to this call for a protest. We're seeing a lot of people share the information.
Right.
And, I just think that seeing that all of that happen on national news is really inspiring people here on island to show up. So we're expecting a pretty big showing on Friday.
Yeah, let's go over the details of the protest real quick, Maria. So Friday, where and how are you guys adhering to all the COVID measures?
So Friday, it's going to start at 3 p.m. We're going to have a comment drive at the same time. So we're going to have a tent. It's going to be a red tent, and we're going to have people behind a table taking comments for this project. Comments might not be able to reverse time and get these 3 historical sites back, but they might be able to prevent others from being impacted. So we're going to have a comment drive. We are encouraging social distancing. We have some cones, orange cones, that we're going to be setting up across the protest line, and we are telling people to bring masks. We actually purchase masks, for those who might forget their masks, to distribute those. We have, hand sanitizer. We have, we're taking all of that into account. We're going to try to make this protest as safe as possible.
Right.
And we also have a code of conduct that we are, sorry, my toddler's here.
No problem.
But we have a code of conduct, this is something that we've applied to protests in the past, but just for people to know that we're taking safety very seriously, that this is going to be a peaceful action. We're a nonviolent group. We are encouraging people to always let the moral value of respect to guide our words, actions, and expressions. We're asking nobody attack the beliefs of others, no spoken or written profanity. We're asking the protesters to be mindful of everybody around you, especially young children and our manamku. No smoking of any kind and no alcohol. We're also asking people to carpool. There might be limited parking, so it would be really helpful to have everybody carpool. And we're going to have volunteers set up along the protest route to make sure that the order is kept.
Right, and
I wanted to ask. I know that one thing we've learned during this entire COVID process is the fact that the governor, and she's expressed it many times during her press conferences, about this good relationship that she has with Joint Region Marianas, and so. Having said that, and I'm sure you are aware because you probably heard her say this, has your organization or any of the organizations that are participating in this press conference today, have they had any discussions or expressed their concerns to the governor as to what has transpired over these 3 sites?
We are asking our members we kind of put out a media campaign to have our supporters reach out to the governor, but this is all kind of new information. We do have that on our list of things to do, that we do need to meet with the governor. But, as you guys have covered in 2018 when Magua Village was destroyed, that was kind of under the nose of the Guam Preservation Trust. And, the community had no idea that this had happened. And when 25 groups met with the governor in response to that, the way that she kind of was looking at the whole situation is she admitted at the table that in our political status, she really can't do anything.
She said
is what
national security.
Yeah, she said, this is national security, and I just think that our island has sacrificed so much. We're a 212 square mile island, and this is a massive marine base, another military base on our small island, and the Marianas is being turned into the largest military industrial complex in the world. And that's not a legacy that we want to have for our future and for our children,
So the governor tells you guys this during that meeting, and then that's it. Then you said 2018. That was 2 years ago.
Sounds like you guys are kind of done with the governor.
We did request a follow-up meeting, but she did not respond to us. So, I'm very disappointed that our leaders are silent at this time. I know that, COVID is definitely a priority at this time, but we can't just lie down and let our sites and our history and our identity. I mean, all of these are tied to our identity, and we've been colonized for 300 years, and we have lost so much information about our past. So these sites could hold keys to learn more, and our identity really is being, our identity is tied to these sites. And so when they go and they move forward with clearing them without consulting the community, it's as if they're telling us that we don't matter. And, if we had that opportunity to comment ahead of time, we might have been able to provide information, get involved, provide comments and critique that could have made project changes to preserve the sites. So that's what we have lost out on, having this comment period be after these sites are already cleared. So again, members of the community, we ask you all to come out. We need to speak out as a community because our leaders are not, they're not advocating for our cultural heritage. So
there's a press conference, Maria. I know we're going to be covering it.
It's it's going to be on Zoom too, right? 11 a.m.
Yeah, it's going to be on Zoom, and we are also working on having it stream live on Facebook.
Right. Okay. So we just wanted to bring you on, and then maybe a little closer to the protest, we'll get you back on to do a little catch up. So thank you for the call, Maria.
Thanks, Maria.
Thank you, guys. Have a great day.
Wash your hands.
Bye.
Okay. Yeah, Bree. I agree with you. I think that we need to hold the military accountable. There's no doubt about that. But when our own elected leaders are, they might not be in the bulldozer driving over the ancient villages, but they're giving the military the keys. I think we got to hold them accountable as well. I don't, and I know she said that we're not looking past our local leaders, but they're getting away with it. They're getting a pass. They're getting a pass.
Right.
And I just don't agree that, there's a lot of things that are beyond our power, but if we had a governor who you guys told everybody to vote for, remember, Pertay Lategzan came out and endorsed Governor Lulian Guerrero, which was weird. I thought it was kind of weird. And they did do work to get candidates elected. All right. They really pushed for Senator Kelly Marsh Taitano, Senator Sabina Perez. These two came from their group. And I think what happened, and I know these guys, it's very hard to say, but I think once they started mixing politics, and I mean politics like campaign politics, like, we're going to go endorse the governor, even though we don't even know where she really stands on the military buildup. To me, that was a real stain on not their credibility, because I believe that they believe in what they're doing, right? But once you start getting mixed up with politics, you see what happens. You play with fire, you get burned, and they got burned by the governor. They got torched by the governor.
I could feel it. I feel like a punch to the gut right now.
Yeah, and I don't know why we're still tippy-toeing around it. I don't know why. Is it because they think that they could make a last-minute ask to the gov? The gov is not going to stand up for you guys. She's not. There's no way. They are pro-buildup all the way. And so I just think, and we see this a lot in so many other movements, I don't think we can escape responsibility. Not me, but that you guys told everyone to vote for her. And now Edzigi look what we got. And so I just feel like if we want to change things and call for action, then maybe we need to call out our local leaders as well, because the military is going to do what the military wants to do.
Yeah.
Right? But if you have an elected official from a territory of the United States making noise, asking questions, calling for accountability, it means a lot. It means a lot. Like if our governor was to stand up and say, no, no more bulldozing our sites, SHPO, stop everything. What do you think the military, they would flip out. But that's not going to happen because they've cozied up to our governor so much so that she's got the admirals coming to the press conference. They, she toured the base. They saluted her. I think they really got in her head.
There's music videos.
There's music videos of her waving bye to the Roosevelt. I mean, I'm just saying, and I'm not on either way condemning the governor for supporting the military. I mean, it's a reality, right? I'm not. I'm just saying that if we're going to be protesting about the military buildup, we can't just protest with the military anymore because our local government is holding their hand as they go trample on our history.
And they've been protesting the military buildup. You know what I mean? Like, this isn't like the first protest that has been held.
Right.
It just seems like there needs to be a change.
And that change, to me, has to be calling out our local government because people see it. They see the contrast. They see, in some ways, the hypocrisy. That we're going to go hold the feds accountable, but just like not look at our local government who's enabling this. Because like I said, they don't need the governor's permission, but damn it, if our governor is standing up and calling Time Magazine, calling the new you know what I mean? It's going to be news. But it's not going to happen. And so I feel like instead of tippy-toeing around and, saying, oh, we asked the governor for a meeting 2 years ago and we never got it. I just don't, you would, there are a lot of people who are pissed off at this administration, and you could galvanize all of that sentiment the way you're looking to galvanize all the support that Black Lives Matter has gotten locally, right? And that's all. I just wanted to speak on that because these are my friends in Portaila, Texas. I believe in what they're doing. I think that, they have that conviction. They have that passion, they have that drive that, we're in a huge renaissance of Chamorro identity now. And these sites on those bases could teach us so much that we don't know about our history. And that's really what it's about. To me, that's really what it's about. It's not about hating on the military or whatever. My dad is in the military. It's hard for me.
Mine too.
But it's not about that. It's about our local government giving these guys the green light to, and what Maria said, she says it's like they don't think we exist. They don't. They don't. They're going to run it over. They're going to erase us. That's what they do. That's what the military does. Now, we need our local government to either pick a side or, step aside. That's just what I think. And I have really tough feelings about it. But again, I just think that Governor Liu does not need to get a pass on this. And you can see it. I could see it in the way that she treats the military. There's no way that she's going to ask them a tough question. They're in, you know what I mean? She's in with them. That's all. I'm done. Anything, Bree? We'll take a short break and come back here on Containing Cup. But those are harsh words, I know, and I'm not going to apologize for it. I just, I see what the activist groups are trying to do. And every once in a while I say, hey, why don't you guys try this or why don't you try this? I said, hey, why don't we do a voter registration drive? They did. They got people to register to vote. They got 2 candidates elected. But the problem was that with Senator Kelly Marsh, she just went all up the governor's skirt basically for the last 2 years. And that's what I'm talking about when you start mixing politics with activism, is you guys want a seat at the table because you believed that it was going to get things done for you. It didn't. It didn't get anything done for you. All it got you is played. And I think that the outrage should be at that level because you guys did get played by the governor. And I just don't, I want to see you guys be as pissed off about that because to me, it's almost worse. The governor's stabbing us in our own back to help the military bulldoze these sites. And I just don't know why in my mind we're not holding her accountable. We're not holding her SHPO accountable.
Why we're not seeing this protest down at Adelup. You want to get stuff done? You show up at Adelup. But then again, they had the meeting in 2018.
I know.
And what did Maria say? They're trying to get a follow-up and nothing.
Nothing, yeah. So I would just say, hey, you don't want to meet with us? I'll tell you, we're going to meet with you. we're going to
They
meet
got
with
a whole
you.
military buildup office down there. Isn't there like a director or I don't even know her name or somebody down there, right?
Right.
Running
And this
military
is,
buildup?
we talked about this a couple weeks ago. It's like on Guam, we're so close. We're so close to each other, but it's so much talking at each other, not talking to each other. And I remember when they had a big protest when Eddie was governor. Remember, they showed up at Adelut with the signs? Let me tell you guys, if you want to make the governor uncomfortable, show up at Adelut with a bunch of signs. It's going to make them uncomfortable. It's going to put the heat on. I mean, they want you guys to go to the military base because they know nothing going to come from that. That's where they want you guys. Anyway, it's 9:51. I think I'm done now. Now I'm really done. We're going to take a short break and come back and end the show on a good note. It's Containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally.
Be healthy. Be informed with ITD.
Half a day. When it comes to applying for unemployment benefits as it relates to the Pandemic Unemployment Assistance and Federal Pandemic Unemployment Compensation programs, the first thing you'll need to do is create an account and register on HireGuam.com. Utilizing this button rather than the Not Registered button at the upper right login box will ease the pool registration process as it was built specifically for the pool program. The first page you'll see is the welcome page that explains the pool program and the 10 scenarios of eligibility that caused unemployment. Read through it entirely, and if any pertain to you, click Next. Input your social security number and then re-enter to confirm. Notice at the top of the page, the eligibility section is completed and the registration process begins. In order to complete your registration process, you will be asked to provide the following: a username and password and select a security question, an email address, or if you don't have one, you will be required to create one with the link provided, your residential and mailing address if different, your preferred notification method to receive benefit notices and updates, any prior military or current military service, education, occupation, your preferred payment method, such as direct deposit or paper check. Now, if you opt for direct deposit, you will need to supply your bank account and routing number. And since these benefits are taxable, whether or not you would like your taxes withheld. When you see the page notifying you to proceed to make your PUA claim, you have completed the registration process and may continue to the work history portion of the claims process. Input your last employer data, job title, and employment information. When the system prompts you to enter your last day worked, make sure you enter the date in which your employment status was directly affected by COVID-19. For example, if you were furloughed on April 1st, 2020, but have since returned to work, you will enter April 1st and not yesterday. Complete the rest of your work history information and add as many past employers as needed. Once completed, you will be required to certify that all information is true and correct, that you are responsible to keep informed of program benefits and reading program material, and that you acknowledge that any false statements are punishable by law and could result in a fine, imprisonment, restitution, and a loss of future benefits. Read through PUA's to-do list and take note of the following. Immediately file your weekly claim. Report all income for the week to include tips, commissions, and gratuities, even if you have not yet been paid. If you return to your normal pre-pandemic work hours or return to work and make over $494,
Para proteger, tan defendi, y
yeah. 9:59. Good talk there. Good morning. Hey, it's all proudly brought to you by Cabo Enterprises, Ambrose Inc., IT&E, Coast 360, and the Bank of Guam. It's the KUAM News takeover of Guam's favorite I-94 on this
Monday.
Raining Cats and Galagos Monday. Well, you know what they say about the weather on Guam. If you don't like it, wait a minute. It'll change. It's 10 a.m. Let's end this show on a good note, shall we? We're going to bring on our girl Davina from McDonald's, and we're going to play some picks here. Davina, of course, you guys have been feeding some frontliners, and as we get the picks up here, Davina, let's just go ahead and start at the beginning, because I know this was a great idea that you probably came up with. How did we?
I wish.
How do we make this decision? Hey, let's go feed some frontliners, and then what was the response when you did?
Well, we're so lucky to be working with a company, McDonald's. Actually, this was nationwide, but it's up to each operator to go ahead and participate with it. And luckily, our owner Joe Adudu agreed that we are going to feed for 2 weeks our frontliners. We did have set meals. They could choose between 3 different choices, and it all comes in a little Happy Meal box because that's what it is. We wanted them to be happy, even for a short, 5 minutes, 10, 15 minutes that they get to have a break.
I'm curious, what was the number one choice of our frontliners? What from Mickey D's did they really love to eat?
It was a little surprising, but of course, they're healthy. Filet of fish was the top choice, followed by our chicken McNuggets.
Nice. Chicken McNuggets, right? I'm a chicken McNugget kind of guy. And then,
I'm more of a quarter pounder with cheese.
Right, and nuggets.
And nuggets.
Let's talk about when you guys did this, having the staff show up. What was the response from the frontliners, Davina?
Well, overall majority, they really appreciated it. They were a little surprised and kind of like, "Is this for real? Are you sure, really?" And they said, "Yes, this is going on." Because of course it was on social media on the U.S. side, and sometimes understandably here in Guam we kind of have to ask, is that special here available? That offer here available in Guam. So yes, we were proud to say you're going to get the free meal for the frontliners here in Guam and Saipan too. Mm-hmm. Our 2 stores in McDonald's there, they also participated from the very beginning of our 2-week program.
Mm-hmm. And I think what's also good about the program that you guys did is the fact that some of your drive-throughs weren't closed. So some of these frontliners that work like overnight shift, graveyard shift, they could come in and pick up a meal. So
yes, 4 of our locations did not stop drive-through, the 24 hours drive-through service. Mm-hmm. The only Tumaling, which was had to just open it to up to midnight, and then later on, a few days ago, we were back on 24 hours, also in Tumaling.
All right, Davina, I got a chance to do a great sit-down interview with Mr. Azuzu. We did a cruising, and I really love a lot of his ideas. Really, man, it's such a down-to-earth guy. And, and seeing that you guys have fed these frontliners, I think it's totally in line with everything that, not just Mr. Azuzu is about, but you guys at the McDonald's family. And that's why we wanted to bring you on and recognize you guys as our COVID heroes for the day.
Thank you.
And I know we're not quite frontliners, but if there was ever an idea to feed us, we.
Oh, very easily arranged.
Okay, I just didn't want to let you go without asking.
Yeah, you're essential too, right?
All right, there you go. Hey, you heard that, boss? All right, thank you, Davina. God bless you.
Thanks, Davina. Take care.
Wash your hands. Okay.
Thank you. Stay safe.
Okay, bye. All right, there you go, 10:04, ending the show on a good note. We do that every day. We recognize somebody in the community, whether it's an individual, organization, or a business that's doing great things to make Guam a better place to be. Good job today, Sabrina.
Good job, Chris.
Good job to Jason Salas and, of course, Jacob Sablan and our digital stream team. Thank you guys so much for listening on the radio. We got that audio stream, Docomo Channel 10, also our KUAM TV 11 viewers. Thank you guys so much for watching. Be safe. Adai Talon. It's going to be Palaxia the Maxi out there today for Sabrina. Good job again.
Good job, Christopher.
My name is Chris, and this has been the multimedia broadcast extravaganza that is containing COVID. All right, gonna leave you with a classic Chamorro cut here, a little bit of Mike Laguatnia, Contraband. My name is Chris. Esta, Joe.
Bye.
Down, eh?